let you know, if you do need a copy of this meeting, if we're running Granite this much tonight, we can get you a much smaller file.
Okay.
Just contact me and me and Josh will get that to you if you need it.
Yeah. Okay, will do. Thank you. Mind if I sit right here?
Taking my mask above my nose, sir.
So would you like me to get a bailiff, or would you like to?
I'd like you to excuse yourself right now.
So just so you know, my father called me this morning to let me know that he had COVID. My father's been vaccinated and wears a mask religiously. So your mask being over your face like a diaper on your chin doesn't do anything for anybody in this room.
I could care less.
The vaccinated and the vaccine is spreading the virus if anyone hasn't put it together yet. Hello, Delta variant. Wake up, people. Wake up.
Where did your science degree come from?
I don't know. Apparently he
Thank you all.
Sir, the county commissioner is doing the same thing I am. Or the school board member. So you go escort him out before you do me.
Whether you are wearing a mask, that's possible. Whether you stay
Hey, sir. I have the mask on.
Don't get yourself in trouble, sir. Sir, come on. Sir, don't get yourself in trouble. Charge is not working.
I've been asked to wear the mask when the school board member had his mask down below his nose, and I put it on as soon as he did. So I am complying, thank you.
No, they've asked you to leave. I don't care whether you comply with the mask or not.
They never asked me to leave, they asked me to put the mask on, I said I'm not going to. We had a school board member that had his mask below his nose, so all these school board members have pulled their mask down at some point or another.
And we were wrong.
We just asked the
He just pulled it down again. Tina Certain has had her mask down to speak multiple times.
When asked, the commissioner put his mask up. And now we're asking you.
I already did.
Okay? So,
And leave
but
me
you
out of your
refused until the
conversation.
bailiffs came.
I had
I'm
no
not gonna put a mask on when your own school board does it.
stupid.
So are you telling us you're gonna keep your mask
I
on?
have it on.
Okay, I think we're good. Okay.
Good evening, everyone. This meeting of the School Board of Washington County, Florida is called to order. Welcome to the August 17th meeting of the School Board. Will everyone please stand for the pledge of allegiance?
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You might offend somebody.
I'd like to share with you a couple of procedural things that we're going to be doing tonight. As you speak, as the citizens, when it's your time, you will then leave the auditorium and go to the Grace Knight room so that we will have more space for other persons to be able to come in. Any questions about that? That's not a good idea. Seeing none, we are going to move now for the adoption of the agenda. It has been properly moved and seconded. Any discussion? Seeing none, all in favor?
Aye.
Motion passes 4-0. At this point, we would like to have approval of the minutes for the special school board meeting, public hearing, for tentative budget and millage minutes, August the 3rd, 2021.
So, Madam Chair.
Second.
It has,
August the third, yeah?
I'm sorry,
August the third?
yes,
Okay, I'd like to say, the millage.
no, the millage.
Oh, the millage, excuse me.
Did you?
No, I just need the millage.
Okay, all right. The next,
You vote, I'm
Need a vote on the,
oh, I thought, okay, go ahead. All in favor?
Aye.
Motion passes 4-0. The next Number 4, approval of the regular school board minutes, August 3rd, 2021. All right, Dr. Carlson.
So, we got a motion. So, Madam Chair, I'll second it. I went over, I spent about 10, 15 minutes talking about a subject that I wasn't even included in the minutes. And I'm going to go right now and present this. Dr. Paulson requested a committee, over a number of times, established to work on finding solution options for the math situation that the governor and the district found themselves in. I thought that was very important. It was completely left out. Just said, I said so, just talk. In addition, we look at what happened, what has happened or happening at the East School and how we can work with the state, with the state problem using our East School. Doesn't mean I'm in favor of anything. I just think I've really got on my nerves is people not getting along. And I told you you already know how I feel about math. Doesn't mean we can't work with the other side and not yell at them. We learn to do that. Excuse me. We need, I'm sorry, drop down. We need to be able to work together. And I wish we would have had a committee. And then whatever they came up with, we can listen to. Doesn't mean how we have to believe or what we believe, but we can listen to each other and try to, work together. We have a very serious problem with the pandemic. We don't need to be fighting each other. We need to be working together, not yelling and screaming at each other. So anyway, I wanted that in the minutes, please. Jenny? Oh, you got it? And I go, this has been eating at me ever since last meeting. We're supposed to be saving lives and teaching, not doing anything about helping our kids raise their third grade scores or keeping people alive. And everybody's entitled to voice their opinion, but we need to do it in a very cordial way. I'm ashamed of myself for yelling. I just couldn't take it anymore. So please, could we have a nice cordial meeting tonight and everybody listen to each other? And then we can go on and we can go ahead and solve the problem. And as a board, we're going to have to make a decision. And we'll have to make a decision that we think is in the best interest of our students and our community. And that's, I feel like all 4 board members will do that. And if it doesn't suit you, it's yelling and screaming ain't going to help you. So please, that's what we should have. That's how I feel. Thank you, Johnson.
Thank you. All in favor of approving of the minutes for August 3rd, 2021? Aye. Motion passes 4-0. Approval of regular school board workshop minutes, August 4th, 2021. So moved. It's been properly moved and seconded. Any discussion? Seeing none, all in favor? Aye. Motion passes 4-0. At this point, we will accept board member and superintendent announcements. Are there any board member announcements? All right, Dr. Simon.
I do have one. I would like us to congratulate Eastside's Pam Bedford. Ms. Bedford was recently named the 2021 Educator of the Year by the American Culinary Foundation. That's a national award, and so obviously we're very proud of her accomplishment.
We'll accept the applause of that. All right. Other board members?
I'll do it again.
Oh, no. Beg your pardon?
I said, yes, we can have it.
If you have something at the end, yes, sir.
I have one as well.
Okay, sure.
I'd like to say to facility staff and all that we toured the Metcalf right before school started on Monday in the Bishop campus. But Metcalf is open, a beautiful campus, and I hope their first day of school went off without a hitch. And that the students there and the staff are enjoying their nice, new, shiny building. It's a beautiful, beautiful rebuild there at its current location, so it was really good to tour that facility with them. So, nice work by all that was involved, and that was funded by our half-cent sales tax initiative. So that's a bonus to the bonus for us as a community.
All right, I don't see any others, so I would like to congratulate board members and naturally the superintendent of schools for all of the work that you've had to do with ABC, MSNBC, CNN, Canada. What's the other international station, Dr. Simon?
No, Swiss TV, but it was translated in Italian, French, and I believe German.
And so if you didn't have that language in your repertoire, then you didn't understand it. But we hope that we've been able to get a necessary message out. And I thank both colleagues for handling that. And I see Channel 20 or Channel 4 over there, and we're not leaving you out either. So thank you. At this point, I would like to move into citizen input. And I want to remind you that citizens, you are going to be speaking not to item number 2 under action. We will accept citizen comments at that time when we are in our action. At this point, let me see who is citizen number 1, and it says,
Madam Chair, I beg your pardon, I'm sorry to interrupt, but the system has changed a little bit. I got together with Jackie Johnson. We're going to ask, would you read the names of maybe 5 citizens? We're going to ask them to go to each podium and line up so that they're ready to speak when their time comes. And then we're going to ask them to go back to where they are sitting, not to leave the room to go to Grace Night. So wherever you are listening, we've got TVs in 3 places now, here, Grace Night, and downstairs. When you hear your name, come to the boardroom. You'll be allowed to come in and get in line at one of 2 podiums. When you're done, you go back to wherever you were. Sit down here if you were in here, go to Grace Night if you were in Grace Night. Go downstairs to the tax collector's lobby if you're there. So if you don't mind, all you'll need to do is perhaps read the first 10 names. We'll give it a moment to see how many people are here. If, and then we'll just keep it moving that way.
thank you so much for the correction. All right, I have for the first citizen, Carrie Gillespie.
And Madam Chair, while we wait for that person to
All right.
come up to the mic.
And the next person would be Tawana Jones, Dr. Crystal Tessman, and Joanne Reifert. I'm hoping that's the correct pronunciation. Ms. Gillespie?
Can I still speak?
Just a minute, what did you say? Oh, just a minute. I'm trying to go in order, but since you're there, Dr. Tessman, go right ahead.
Members of the board and Superintendent Simon, first, I don't have anything really eloquent prepared, but I'm Crystal Tessman, Alaska County Education Association Service Unit Director, and I want to speak on behalf of our bus drivers.
We need to pay bus drivers, attendants, mechanics, and others professionally. We require our bus drivers to have more certifications than RTS, but don't pay them as well. This is unacceptable. We desperately need them to get our children to school safely, and they need to be shown that they have value. And one of the most important ways, besides keeping them safe, that we can do this is by paying them appropriately. So I'm really calling for reclassification or however we need to give them more money. Thank you.
I'm going to ask one more time, please, that we are not applauding tonight. I know it's motivating sometimes, but I'm going to ask one more time that we don't do that tonight.
And Madam Chair, before the next speaker, if you don't mind, I just want to let everyone at home know they can call in and give public comment at 1-800-876-7516. And they'll be placed in line, and we have Adam on standby whenever you'd like to take
And will you let them also know where we are with the citizen input? We only have 15 minutes at this time, and so we will have options at the end of the board meeting for other citizens, and then we will have citizens who specifically want to speak on item number 2
Yes.
under action.
They're aware.
Okay?
You ready?
Yes.
Hi there, good evening. My name is Jana Riker, and I'm here representing SBAC Transportation Department, our school bus drivers and our aides. I have a little bit prepared to speak about a few talking points. I'm here representing us because we're going through a lot, but we're not getting paid like we're going through a lot. I'd like to talk to you about the flyer advertisement we have going around. We're advertising right now and putting out the flyer that's going around. I don't know if you've seen it. It says that we're hiring on at $14.95 an hour. I just want to point out that I only make $1 more than that, and I've been here for 10 years. Once you go on the SBAC website, though, to apply, part-time starts out at $13.95 an hour, full-time starts out at $12.31 an hour, and this could be deterring viable candidates from actually applying for the position. Seasoned drivers like myself who've been here for 10 years have been leaving because someone with 10 years in another county can come in and actually make more money than what I make. What I make an hour and what most of us make an hour equates to about 20 grand a year. Now, I don't know about you guys, but even with a spouse in the house, with a 3-bedroom, 2-bathroom, that equates to the 2 of you needing 2 jobs each. That's a lot when you're raising kids. The average rental of a 3-2 is $1,400 to $1,800 a month, not to mention your GRU bill, which is $400 to $600 a month for a home that big, not to mention all the other bills. I don't need to tell you what they are. You're adults, you already know. We have drivers who are single parents. Can you imagine what they have to go through? I know them personally, so I sure can. These are not the type of job where you want a high turnaround. We're transporting your children. We're transporting your children, your grandchildren. We're transporting the most precious people in this county. We are also going through some of the most dangerous things that we can possibly imagine right now. We have 60 kids on these buses at one time sometimes more than that, because we can fit up to 68 on some of these buses. We have metal mesh filters on our AC systems, so you can imagine how badly we want to keep that mask mandate for those buses.
Ms. Wagner? Ms. Wagner?
Yes.
I'm so sorry, your time is up.
Okay. I just want to, can I add one more thing real quick? I think that it would be better to increase our pay, give us guaranteed 8 hours and make us 12-hour employees and keep the employees instead of having a high turnaround. As a whole, it would make it safer for not only us, but the children and the people on the roads as well. Thank you for listening to me. Have a great night.
Yes, my name is Karen Gillespie. I know that you have seen all the studies at UF and with Brown University on how the masks are dangerous for our children. And yet you choose to ignore that. Our children are at virtually no risk. There's 4.2 million that test positive, and only 0.008% have died. More children die from masking our children with virtually no risk.
Hold your comment for a minute. Ms. Gillespie, did I say your name correctly?
Yes.
Mrs. Gillespie, you need to speak to the action item number 2 when we get to that point on the agenda. You still have an opportunity to say what you need to say, but it'll be at action item 2 if you're speaking about masking.
Okay. I have other points as well that I would like to speak about. I don't feel that the school board has our children's best interest at heart by going against parents' parents' choice, and
Ms.
teaching our children that it's okay to
Ms.
break the law.
Gillespie, I'm not gonna stop you again. Please have a seat, and we'll ask you to come back at action 2. Tawana Jones. And we, citizens, we can use both mics. All right? Martina Ford. Not here. And Shanice Pate. All right. At this point, Josh, we will go into our call-ins since these citizens are not here.
Adam, if you can put the first caller through, we appreciate it.
Yes, sir. Thank you, Madam Chair. The first caller is Debbie Martinez. Ms. Martinez, tonight we have 2 minutes.
Hi, good afternoon.
Thank
you, Dr. and members of the school board. I'm Debbie Martinez, a retired registered nurse and substance abuse counselor, and I appreciate the actions you have taken to help protect the safety of our students, teachers, and staff during the pandemic, and I thank you so very much. Fortunately, we have another public health and safety crisis on our hands, and time is of the essence. Allowing open education consumption of alcohol for 19.5 hours a day on city property and right-of-way throughout the entire city of Gainesville is an open invitation to underage drinking and more violence on our streets. This is a giant change in the long-standing municipal codes that will make life in the city worse and more dangerous for our residents, especially our youth. The city commission will be voting on this ordinance Thursday, August 19th. This is the only chance school board members, parents, and residents living in our community to engage the city commission to vote no on this ordinance. Drinking alcohol in the streets is an activity that appeals to teenagers and young people, placing our youth at risk. Underage drinking cannot be contained down in our city streets. The data is clear. Residents living in neighborhoods surrounding Midtown, downtown, and the east side of Gainesville have suffered the most ever since city conditions started experimenting last September with allowing people to walk around our entire city drinking alcohol. It has been a public health and life safety nightmare for our residents and must stop. What happens in Gainesville does not stay in Gainesville. You may attend the city commission meeting Thursday evening in person and make your comments. And send, or you can send an email to the city commission or phone in Thursday evening with the item that being discussed at 1-800-876-7516.
Our next caller is unidentified.
Adam, you can wait on that. We're gonna take another comment in the room, if you don't mind.
Yes, sir.
Are you Mrs. Jones?
I'm forward.
Yes, one now. Yes, Ms. Ford.
Yes, I was considered, the new school y'all have to Willicott that's way out of Jonesville. My granddaughter, was tested for COVID Friday. She was tested for COVID, and it's so forced for those kids that doesn't have rights to get the kids if they get sick. For instance, my granddaughter told her teacher that her head was hurting and her stomach was hurting. Instead of her telling her to go to the clinic, she told her to go back and sit down in her desk. So her mother they did not even contact her mother and tell her that her daughter was sick. Her daughter was tested with COVID. So I think that they need to move the school either get those kids somewhere that their parents can get them if they get sick. Because I work and I stay on this side of town, so I can't go way to Jonesville to pick up my grand if they get sick. And I would like to find out who this teacher was that did not take my granddaughter to the clinic. Instead of letting her sit there in the classroom all day long and sick. And when she got home at 4 o'clock, she could not even walk. So I would like for them, if they can get the schools, that they can get the kids to even be closer to their home. Because that's too far. Jonesville, that's too far for somebody that don't have a ride. You have to pay somebody at least $30 to take them out there to pick up their kids. And that's what my consideration was for this.
Thank you so much for your comments, and we have someone taking notes tonight, and they will get in touch with you from the school.
Okay. All right.
Preferably the principal.
Well, we talked to the principal, and they didn't even know that the lady did not send my granddaughter to the nurse. The nurse said that she did not even come to the nurse clinic. So that's how we know that the teacher did not let her go there. So the whole time she was sick in her classroom. And now she has COVID, and she just turned 6 years old Wednesday.
All right, thank you so much for your comments.
All right, thank you.
We have time for one more.
We have somebody over here.
Are you Mrs. Page?
Yes, ma'am.
All right, Ms. Page.
Good evening, board members. I'm here on behalf of my team and myself. We as a union come to work and put our lives on the line to make sure teachers have kids to teach and no child is left behind. But we're out here at transportation working on a pay grade level 24 when we should be on a pay grade level 28. I worked every day last year thinking about my 3-year-old son and what can I do to keep us protected. The shot is an opportunity, but my child is still not protected because of his age. How can I protect me and not him? Employees don't want to come to work because the pay is too low. We have people here that's going on 30 years on a 21 an hour pay. We wake up before sunrise, and sometimes we get off after sunset. We have to search for addresses in the dark, drive in all types of weather. The price to renew your professional license is extremely expensive because you have to pay for each endorsement. But yet our pay doesn't match the quality of the license. Working long hours, the job is stressful, and you have to monitor students, watch the road, and keep account of who boards and gets off the bus at each stop. You all speak of getting aides on the bus, but we barely got drivers because the pay is too low and aides aren't no different. I had perfect attendance last year, even through the pandemic. I did not miss a day. I'm going to always be dedicated to my students. Please consider a pay raise for all your bus drivers and bus attendants. Thank you.
Thank you. At this point, we're going into the consent agenda. May I have approval, please?
So I'd like to recommend that the school board approve the consent agenda as described in items 2 through 8.
So moved.
Second.
It's been properly moved and seconded. Any discussion? Seeing none, all in favor?
Aye.
Motion passes 4-0. We're at action item at this point, and we're at action item number 1. And Ms. Andrew.
Good evening, Superintendent Simon, Madam Chair, members of the board. I'd like to present to you change order number 3 for project SBACB 1904, Santa Fe High School auditorium renovations as an action item. This change order adds $34,574.45 to the contract, revising the contract total to $1,071,933.09, and represents an increase in the costs for University of Florida environmental health and safety permitting requirements, unforeseen conditions, as well as owner scope increase. This change order adds 30 consecutive calendar days to the contract time. Superintendent recommends that the school board approve the change order number 3 in the amount of $34,574.45.
So moved.
It's been properly moved and seconded. Any discussion?
Yes, ma'am.
Mr. Hyatt?
Thank you, Madam Chair. This is important to me, and I remember going to a band rehearsal there about 4 years ago, and I started thinking that this school, which is one of our older schools physically, really needed some upgrades. And the auditorium, I think the director at that time was choosing to rehearse with the air conditioner off because it was so loud over the stage. And so you imagine having a play or a concert and you have this, air conditioner coming on like a truck going by, and I'm so glad that the folks at Santa Fe High School, the students, and that community, because it's also going to be for the community, are getting a first-class facility that they deserve and have waited a long time for. So I just wanted to say thank you to the operations department for being on top of this, and I'm very pleased to be in favor of this project. Thank you, Madam Chair.
All right. Any other comments? Seeing none, all in favor?
Aye.
Motion passes 4-0. Thank you.
Thank you, ma'am.
Dr. Simon, action item 2.
Mr. Coles will be coming out to present.
Board members, superintendent, right before the beginning of this year, the board voted for a student mask requirement for the first 2 weeks of the school year. Before you is an action item to consider the continuation of that mask requirement. As we did at our last meeting, as we continue to do, will be led by our medical experts, but also those that are experiencing this on a variety of fronts. So before I talk about what the district is experiencing right now, I'm going to have some of those experts present information to you to help you make your decision. Specifically tonight we'll have Dr. Martin Young from UF Health, we'll have Ed Jimenez, the CEO of UF Health, Shands Hospital System, Dr. Desmond Schatz, Dr. William Workosh, Dr. Kathleen Ryan, Dr. Anita Roll, and Commissioner Ken Leno. So I'll now invite Dr. Martin Young to the meeting.
Thank you.
Good evening, Madam Chair, members of the board, and Superintendent Simon. First and foremost, I would like to thank each of you for listening and voting at the last board meeting to allow mandatory masking for students for the first 2 weeks of school. Your tremendous bravery at a time when so many obstacles have been set did not go unnoticed. Your courage and your commitment to do the right thing resounded amongst those in Alachua County and around the world. As the voice of children, the voice of reason, you are being heard. Across Alachua County, there are currently so many students and staff out of school in quarantine after only 7 days of school. The first week of school was a challenge, to say the least.
grappled by tremendous bus delays due to more bus driver absences than usual. And as we are all aware, 4 educators in Broward County died of COVID-19 within 24 hours, just days before classes were scheduled to start. This is terrifying. So we return today, imploring you once again to choose safety. The peak of this surge is still ahead of us. We are not there yet. There are still so many uncertainties in the course that this surge will continue to take, particularly with the University of Florida's fall semester set to start next week. We ask that you vote to extend the mask mandate for students for at least another 8 weeks to allow time for our community to gain better control of this surge. Hopefully by that time we will be in a better place. The peak is still in front of us, and we are still several weeks away. And that's based upon the most optimistic predictions. The sheer volume that this surge is requiring has completely changed how we as physicians approach care. Each day, we are seeing more patients in a day in our clinics than we ever have. So many kids and thus families are contracting COVID-19. Currently, in our pediatric clinics, we are placing holds for the next 2 weeks on scheduling any new well-child exams, which are physicals, or new patient visits. And this is in order to accommodate the increased demand for urgent visits for COVID exposures or children that have become ill. This is unprecedented. Providers are being mobilized and shifted around in various ways in order to accommodate the need, but I tell you the need is so very great. I'm sure each of us have asked ourselves numerous times over the past year and a half, but more often now, what kind of care am I truly providing my patients? The fatigue is real, the anxiety is real, the burnout is truly real. The daily fear from a pediatrician's perspective of losing any patient to this disease is immense. This is not sustainable. Again, I implore you to extend the mask mandate for students at least another 8 weeks. We have to slow the spread. In the absence of mandatory masking and continuing at this rate, the end results are catastrophic. No one illness should cause this degree of morbidity or mortality. No disease process should ever require the magnitude of manpower or resources that this one currently is. But that's the reality of the day in which we are living. Today, you will hear from several medical professionals of different pediatric disciplines who have seen different phases of the pandemic and its implications. But all are here today with one common goal of extending Alachua County's mask mandate for the students. You will hear the terrifying real-time data, such as our county's current positivity rate, the current conditions of our ICUs, our emergency departments, and emergency response teams. And this is all as our county and world grapples with the potential of scarcity of medical resources to meet the growing demand. A better day will come, but we are not there yet. Thank you. Thank you.
Next, we'll have Ed Jimenez. Ed is the CEO of the UF Health Shands Hospital. He'll be followed by Desmond Schatz.
Good evening. Thank you for inviting me actually to comment. I've been asked specifically to comment on the volume and what's going on inside our hospital. So today, this afternoon, we have 231 patients in the UF Health Shands Hospital who have COVID. We're seeing an unprecedented number of patients in our ICUs. It's certainly been at a increase that we haven't seen before. We have blown through our peaks from January, and there's no question that this particular current surge seems to be more contagious and gets patients sicker quicker. So the hospital really is at a point where we're having to make some decisions that are highly uncomfortable for really our community. Over the last 3 weeks, we have started to reschedule elective surgeries, including elective surgeries that require an ICU. And so, to put it in context, and maybe to illustrate the impact on human beings, if I were a patient and I saw my physician, and my physician indicated to me that I needed surgery, but I could wait. But the kind of surgery I needed would be on my heart. But I could wait. Naturally, I would expect to go to the ICU after heart surgery. That's a pretty easy linear relationship one can draw. So imagine I get myself emotionally prepared. I ask my family to make sure they're available if they don't go to work or don't go to school or whatever they do. So then my doctor calls me and says, let's ask some questions. How are you feeling? Can we do some lab work? We just want to be sure that you can wait a little more, because if you can, we're going to reschedule your surgery. So that's what we're doing now. And our RCs are taxed to the point that if we continue with the current surge, next week we will likely start canceling additional surgeries that are transfers in nature. So let's say somebody's sitting in a hospital in Miami that needs us. We're going to say no right now, at least if the current surge continues. The workers are tired. There's no question that all the nurses, all the doctors are exhausted. And the reason to postpone and cancel, one is to create the bed space, but the other is to bring in some reinforcements. Because nurses don't grow on trees. Respiratory therapists don't grow on trees. We have to take people from other areas and move them. So that's where we are now. To give you a little context about kids, in the beginning of the pandemic, really, let's call it from the beginning of the pandemic through the end of 2020, at the UFL Shands Children's Hospital, we had between 0 and 3 patients that were kids at any time. From January of 21 through July of 21, it was between 1 and 3. So not remarkably different. From July till now, we're no less than 5 kids with a maximum of 12. Today we have 11 kids. 4 of them are in the ICU. We are seeing kids in the ICU at rates that is different than before. So the data is perfectly clear that this surge is really complicated than I've ever been. There's no question. I've also been asked regularly, what is the vaccination status of our patients? So of all patients, of all 231 today, 90% are not fully vaccinated. Of the 11 kids today at the hospital, none of them are fully vaccinated. And 6 out of the 11 would have been old enough to get the vaccine. So the other data point that I get asked about regularly is how many of our patients come from out of county? And it's a little more than 50% come from out of county. But I quite honestly don't know what that data tells me as a hospital administrator, because what I know is that our doctors and nurses are taking care of those patients regardless of what county they come from. I do understand that it makes sense at a public health and county health department level, but by the time they're inside of the UFL Shands Hospital, where their home address is a little secondary to the nature of the problem that brought them here. So those are my comments on the data. I am happy to answer questions or do what the board asks me to do.
I have a question.
No questions. They asked for the board to ask questions, sir. I'm sorry. No? Okay, next, Dr. Shackle.
Thank you very much, Superintendent Simon, Madam Chair, and members of the school board. Hello again, I am Desmond Schatz, and I serve as a professor and the interim chairman of the University of Florida Department of Pediatrics. And I stand before you again to entreat you to continue to do what is best for our students in our community. I've dedicated my life to the science, to the health, and to the well-being of children. And I really urge you as a pediatrician and a scientist and a father to make that classroom experience safe. As I remarked about 2 weeks ago, I thank you profoundly for what you do on the children's behalf. Though we come from different professions, we share the same passion for the children whose lives are entrusted upon us. Now, with this current resurgence of COVID-19 and the Delta variant, we are firmly back and entrenched in the global pandemic. And this is not philosophically, but absolutely right here and now. And we in Gainesville, Florida, are one of the hotspots within the United States and across the world. I deeply appreciate the leadership that Dr. Simon has demonstrated in thought, in word, and action. And I stand before you pleading again to you today to remain vigilant. We have many children, as you heard from Mr. Jimenez, in the hospital, even in the intensive care unit, fighting for their lives right now, and they're infected with this COVID-19. And this intensity of the surge requires that we use the two most important tools available to us. We need to continue to wear masks. I understand that this feels foreign, especially for the children, as they grapple with social cues and fine learning. And I understand that as a father for my child as well. However, the best scientific evidence, this is not my evidence, it's scientific evidence, shows that the more that the community wears masks, the safer we all are. And again, it's not just my opinion. There is a direct correlation between wearing masks and our children's safety. Though we need to wear masks that work better for children and fit better for all of us, and we've seen that tonight, the data are clear, and you'll hear more about it. Masks limit the spread. And we're already doing so much better here in Alachua County than in Hillsborough and Broward County. It is not about I, it is about we. We also need to encourage vaccinations. Only our high schoolers and some of our middle schoolers are eligible for vaccines, but these vaccines are highly effective. So today, the data are far worse than they were 2 weeks ago when we enacted the mask ordinance. There are 4.3 million kids now in the United States, and there's a rise in every week. This is the 7th consecutive week, and our children are 15% of all cases. And most relevant to you, and you'll hear it again, that the positivity rate for COVID is now about 25%. That's 1 in 4. Mr. Jimenez told you about the kids in the ICU and on oxygen, and fortunately, none of them have died since the last time. We are overrun with patients, and we are having a hard time meeting that in our pediatric clinic. But we are committed to our community. We are redeploying pediatricians, even subspecialists, to primary care to meet the needs of the children. So we want to limit the children who are landing in the emergency room unless they absolutely need it. But we need your help. Just like you, our nurses and staff are burned out with this long epidemic. We want this to be over, but we aren't there yet. I strongly believe that the 2 weeks of mandatory masking is working, and that the lag effect of what we are doing now in Alachua County will help us not be further overburdened in the next few weeks. Continuation of masking is needed until we see signs of a community decrease. When that happens, in the next few weeks, I will be the first, among the first, to happily wave my mask in the air. I won't do that tonight. Until then, we need to take care of one another. As a father, a pediatrician, and a physician scientist, I challenge you all to do what is right for our kids and continue universal masking in schools. Thank you very much.
458 days. We are 458 days in. You haven't slowed or stopped anything.
Vaccine spreading the virus, you guys put it together.
Just a minute. Citizens.
You didn't talk about death rates.
Citizens, we are more respectful, but I will ask you out. Point taken, I hope. Our next speaker.
So we have Dr. William Bortkosh from UF Health Pediatric Critical Care.
Thank you, Madam Chair, board members, superintendent. I really appreciate your taking the time to listen to me, to us, and to the community. I'm really thankful just to have everyone in the same room to discuss everything. I think it's probably the most important thing that folks as a community just kind of share their experiences and their perspectives. I am an intensive care doctor. I work in the pediatric intensive care unit at Shands Hospital. Today I'm just planning on focusing on sharing my recent experience and my past experience with COVID and sort of the changes that we've seen over the years. I'm not going to speak much more beyond that. So during the first wave, during the Alpha variant, I was very thankful to find that we did not see too many primary COVID infections. Most kids who were in the unit, some of them were sick with COVID, but most of them just happened to have COVID and they had something else. And that was a relief. I was very happy to see that the kids weren't getting as affected as much. This new wave, this new variant, it must be different. So I worked last night into this morning, and over the last few weeks, about a third of our kids in the unit are infected with active COVID. They are on non-invasive masks, so what that means is like a mask around the nose, covering the nose and the mouth, help them breathe. They're on anti-inflammatory medications, they're bedbound. Many of them are in the hospital for 1 to 2 weeks. I apologize for having to correct Dr. Schatz. There has been one death in a child, a healthy child, not a complicated child, and I was unable to help that kid, and it happened very quickly. I am genuinely scared for the children. I'm scared for my staff. I'm scared for my family.
Can I sit in this corner with you? Yes, sir.
I don't pretend to know what I don't know, but I do want to help in whatever way I can. And I know that the ICU is distinct from what most people experience in their day-to-day lives. So today I just wanted to come forward and sort of share my experience with you. I think it will pretty much conclude what I have to say. Thank you.
Thank you. Our next speaker is Dr. Kathleen Ryan, who's the UF Health Pediatric Infectious Diseases.
Thank you, Madam Chairman, board members, and Dr. Simon. Thank all of the rest of you for being here today and supporting our community. For those of you who don't know me, I am a pediatric infectious disease specialist at UF, and the associate chief of the division, and I was also a member of the Scientific Medical Advisory Council last year. I'm also the medical coordinator for the controlled flu program, which brings you your flu vaccines in the schools. And we use that same infrastructure to bring like COVID vaccines to the students in the schools, which we're doing. I'd like to recognize the outstanding leadership of our school board and our school superintendent for taking the important step that you took on August 3rd to make school masks mandatory for the students for the first 2 weeks of school. So this shows that our community is willing to stand up and do the right thing. Our leaders, you all, are willing to do the right thing even with threatened significant consequences. They're willing to do the right thing to protect our children. As the late John Lewis, the activist, said, get in good trouble, necessary trouble, and you've just done just that. Our community has been on national news, international news, for doing what is necessary and what is right. So here we are on the 17th, reassessing where we are with the latest COVID-19 surge, reassessing whether we need to continue the mask mandate. So as you've heard, and I wish I can tell you that we are in a better place than we were back then, but we aren't. So we need to see and continue to do what's right. We have seen a rise in cases in all age groups. The test positivity rate for the pediatric patients is almost 27%, as Dr. Schatz mentioned. So that means more than 1 out of 4 kids that are going to the doctor and getting tested are now positive. We have not seen that. That has been unheard of. We continue to have patients in the ICU. We consult on the majority of them. These children have been much more sick than anything that we've seen before. And luckily, we haven't had any more than the 1 death so far in the pediatric population. We are also concerned that we might see a rise in admissions for MIS-C, the multi-system inflammatory syndrome in children, which generally occurs 1 to 2 weeks after they get COVID, and with the number of kids testing positive for COVID now, that's a real possibility. These kids are very sick when they come in, and they often require ICU care. So schools have only been in session for 6-7 days, and there's already been over 100 cases in the students and 79 in the staff, and over 600 students are quarantined. This really reflects more what was happening in the community before school started than it does indicate that we've had spread within the classroom. So Marion County just announced that they're going to do a mandatory mask policy with an opt-out option. And I saw that in Palm Beach County, even though they've started school only on August 10th, they've had over 500 cases since school started. So we need to continue to do the right thing to protect our students, the staff, the teachers, the bus drivers. We need to continue to use all of the tools in our toolbox. We need to continue the masking, physical distancing, hand washing, testing and contact tracing, isolating and quarantining, and that's a lot of things to do. And we need to continue to promote vaccination, and that's the most important thing. As Mr. Jimenez said, 90% of the patients that are in the hospital and are sick right now are unvaccinated. We're certainly not in any position at this point to let up what we're doing now. And we know masks help prevent the spread of infection. There's data coming out more and more that's documenting this. Wearing a mask helps someone who's infected limit the spread to other people. So there is perhaps a little bit of good news. We have some world-renowned modelers at the U.S. Emerging Pathogens Institute, and their most recent model suggests that this surge may actually peak in Florida and our community within the next 2 to 3 weeks. And then at that point, there's a rather sharp decline in the number of cases, so that maybe by early to mid-October, we will actually be at pre-surge levels with the virus. And this has happened in other areas of the world where they've had this Delta variant surge. So, for now though, we really need to stay the course. We're not there yet. We haven't hit the peak. And if we let up on the masking, the peak will only be higher, and there'll be more hospitalizations, more potential deaths. So I think given that timeline, then we need to really consider the mask mandate for at least an additional 8 weeks to get to that point. And then we can reassess. We do have students starting next week, and there has been some talk of whether our community could have a double peak because of that. We're hoping not. We're hoping enough of them are vaccinated and they wear their masks for that to happen. So I hope, just as all of you do, that we'll get back to where we were before this surge. But for now, we really need to continue the mask mandate. And I know we all want to continue to do the right thing for our students and our community. Thank you.
Thank you, Dr. Ryan. Our next speaker is Dr. Amit Rawal, and he will be actually through Zoom, and he is at North Florida Regional Medical Center in Emergency Medicine.
Good evening, Madam Chairwoman and Board, Superintendent Simon, staff, and everybody there in the audience. My name again is Dr. Amit Rawal. I was asked to share the current status of emergency services in our community. I've been an emergency medicine doctor and frontlines healthcare worker for over 12 years right here in Gainesville. I'm also the Associate Medical Director for Alachua County Fire Rescue Emergency Medical Services, our local ambulance and fire service. Today, more than ever before in the pandemic, we are at critical mass. The number of COVID hospitalizations continue to surge locally, with both major hospitals up over 50% in terms of COVID patients admitted compared to when we last spoke 2 weeks ago. The Alachua County COVID dashboard, for the first time yesterday, crossed over 400 COVID patients admitted across UF Health and North Florida Regional Medical Center. And that includes over 150 patients admitted into the ICU. The number of cases in Alachua County is still increasing week over week, and the positivity rate in Alachua County rose last week up to 16.4% for all children and adults, and that's according to the state dashboard. As our pediatricians have just stated, we now consistently have multiple children who are admitted to our pediatric hospital and into our pediatric ICU. The hospitals, they're currently operating within surge plans. There's nothing normal about what we're doing day to day inside the hospitals. Elective surgeries are being canceled or postponed, and visitors are being restricted in certain areas. The men and women at our hospitals work around the clock to help care for our community. Our ambulance service, we're operating at high levels of transports, with some particularly busy days in the past few weeks being almost 25% higher compared to the average number of transports per day in 2020. It hasn't been uncommon in the last 7 to 10 days to see 110 patients being transported a day by our local ambulance service, when the average across all of 2020 in the early stages of the pandemic were between 85 and 90 per day. Projection data, including epidemiology data along with other forecasting models, they project a peak that is still out in front of us, as you've just heard, with a slow decline in the weeks that follow and hopefully a return to previous lower level of disease somewhere between 8 and 12 weeks away. Again, these are projections. Close monitoring, potentially adjustments may be necessary as the situation unfolds. So, I respectfully say to the board and to the community, let's not exacerbate this critical situation at this critical time. Masking, distancing, vaccine administration, and contact tracing, these are the tools. They must be employed to keep us from further overwhelming emergency capabilities, to bring relief to our residents and children, and to help the hospitals and frontline healthcare workers and all healthcare workers who are doing their very best to take care of this great community. Thanks for listening.
Thank you. And next we have Commissioner Ken Cornell. He is the chair for the Alachua County Board of County Commissioners.
Thank you, Dr. Simon, for the introduction. Honorable School Board Member, Madam Chair, it's a pleasure to be here again. I stood here 2 weeks ago and watched your courageous actions of putting the mask mandate in place for 2 weeks. I want to just share with you kind of what's happened at the board level. On that same day, August 3rd, the county manager implemented a policy for our staff requiring vaccinated status be reported to us by August 31st. She also implemented a mask mandate in all county facilities. On August 5th, I signed a local state of emergency based on the data in our community. That action was ratified on August 10th by the entire board. In addition to that, they extended the local state of emergency and our board voted in support of your board based on the threats from Tallahassee to your funding. All of those actions were 5-0. It was a unanimous action of each of your county commissioners. Commissioner Anna Frizia, Commissioner Chuck Chestnut, Commissioner Mary Helen Wheeler, and Commissioner Mary Alford. Today, we scheduled an emergency meeting to consider a county-wide mask mandate, and that'll be held tomorrow in these chambers. Again, that was a 5-0 vote. Today on your site, you reported you had 611 students in quarantine, 35 staff in quarantine. Today, our county manager reported that Alachua County staff had 30 positive cases, 12 in quarantine, and an additional 6 that are self-monitoring. To basically conclude, I'd like to thank you for listening to your local scientists and your local medical advisors. I'd like to thank you for working tirelessly every day to keep our kids safe while you monitor our local data. And whatever action you decide tonight, I ask you that you please continue to do all you can for the safety of your staff, for the safety of your children and families in the district, while we are currently under a local state of emergency. Each of you are courageous, brave, and very much appreciated. Continue to take care of each other.
Thank you, Commissioner. Commissioner Cornell?
Yes, ma'am, I'm sorry, I
At
didn't hear
the
you.
present time, he'd like to know.
What is your state of emergency?
So we have a local state of emergency that we put in place on August 3rd, which basically encourages folks under President Biden and Governor DeSantis' advice to get vaccinated. It also encourages each of our citizens to follow CDC guidelines, which are to wash your hands, continue to socially distance, and when you are inside, to mask. So that's our local state of emergency. Tomorrow, we will be considering an actual order, which would require masks inside for any buildings where the public has access.
Are you looking for a date?
Great question. So the question is, are you looking for a date? So under the recent legislation that the legislature passed and the governor signed, the county is limited to any orders for 7 days, not more than 42 days, 6 weeks. So tomorrow what we will consider is a 7-day order, which would then potentially be renewed every 7 days, not longer than 42 days. Under that legislation, the governor has the ability to void that order at any time. We hope he would not.
So you're saying there's no order right now?
There's no order right now.
So we can take these masks off?
No, sir.
Why
You're
is that?
In a county facility, you are required to wear a mask, and you are currently in a county facility. If you take your mask off, you will be removed. Any other questions, Dr. Paulson?
No,
That makes a
thank
lot of
you.
sense.
Yes,
Member Turton?
So, Commissioner Arnold, it's 42 days total or 42 days at any one time?
No, ma'am, it would be 42 days in total. In total.
Thank you.
Any other questions?
So I have a question. So after the 42 days, when you reach that status, if you needed, if we were still in an emergency situation, would you be able to extend at that point?
Not under the current legislation.
Okay, so
Yeah, these are things that we will be discussing tomorrow night, and in conjunction with the data that we receive from our experts and that we're receiving tonight from yours, our idea would be to try to flatten the curve of the peak. And so again, this would be an order, a mandate. Right now, we have a local emergency action, which is a strong recommendation for our citizens.
Thank you. Thank you.
Okay, you're welcome. Thank you.
Dr. McNeely, I'd like to take a moment. I'm just going to review the dashboard that's currently updated for our cases in our schools. I can add a little context to it too. This is publicly available on our website. And I'll tell you, it is not fully up to date because the cases keep coming in. It is hard to keep up with it, but that's why I wanted to show you because you can kind of see where we are and where we've been before.
Thank you.
So right on our school board website, on our COVID page, we have our dashboard, one of these links. I'm also going to go back to the vaccine page so we can talk about some of those opportunities there. So this reflects all the cases reported in Alachua County Public Schools since July 1st. So since this new Delta variant surge has started to really hit us. So within the last 14 days, there's been 162 students who have tested positive and 58 staff members. And you can see that this last week, this is the first week of school.
So I just want to interrupt for 1 second, just so you know, this morning that was 100 students.
So since morning, we added 62 students?
Yes, so that doesn't mean they took their test and it was positive, but it means they recently took a test and it was positive. So that's how these are being reported. To compare that to where we were before, this is all of our cases since the beginning of the pandemic. So within our first week of school, we have exceeded our highest point at any time last year. Now, I will say that these cases are not from school. These are cases where they tested positive because they were exposed in home or in the community. So, for example, on the first day of school, if the student tests positive, it's not a disease they contracted out of school. However, what that means is that we know that it's coming into our school. We know that parents are testing positive and dropping off their kids at different schools. We know that there's kids who develop symptoms in the middle of the day, there's some kids who don't have symptoms at all.
Can I ask a question?
Yes, sir.
And I looked at it quickly today. How, I'll start, I'll leave it, hold on, so you can hear me. Okay. Thank you. What's the ratio of older kids to the younger? Can you ever break down a cutoff point?
I can
maybe
yes.
third grade.
So these are all of our cases, and actually anyone can do this on the website. You can break it down by the school level. So if I look at just the elementary schools, that's where the spike is compared to everybody else. It's about the same.
Be interesting if you could give us information where the spikes are and the vaccines are for us.
So I can speak, from what I've seen, the spread is mostly in the, or not the spread, the cases are mostly in the elementary school. That's just due to the nature of the vaccination, because our older students are right now eligible for it. So they are testing positive less, but they are also less likely to be quarantined as well. Because of that vaccination.
I know I'm asking, but I'm just quarantine. How long what do we quarantine and what's the timeline?
Sure. So that is something that we work with the health department on specifically. So if someone in a school building tests positive and you're in direct contact with them, so that's defined by within 6 feet for 15 minutes. That doesn't have to be 15 minutes all at once. It could be throughout the day. But if you're in that direct contact, if you test positive and you go home and you don't get tested, you can return after 7 days with no symptoms. If you go home and you get a test, you can get a test that we provide at the schools, and you can get tested on the 5th day, and you can return after that as negative. So this is shorter than the quarantine times from last year. And this is directly from the emergency rules from the health department.
So if you get a test, either 5 or 7 days quarantine.
Right. Now, if your symptoms are going on past that, you might, be evaluated. But that comes from the State Department of Health. And again, since the beginning of this, I thought this was kind of staggering. Just the trend of where we were versus where we are now. And what that tells me is that we can't just do business as usual. It was flat for a pretty long time, and that was a great time. But we've got to change how we operate. So with that, I'll turn it back over to Superintendent Simon to continue with. Actually, if I could jump in for just 1 second. The vaccines we have available, if you go to any middle or high school or you're a parent, right on this page, the school board website where it says vaccines, we have this available in the schools. We also have it, all the links to the health department that you have opportunities. You have so many opportunities to get this to protect yourself and your family and your school.
I encourage parents to look at VAERS, the vaccine reaction. Many people are having adverse reactions to this vaccine. Not informed consent. No, but they're not being informed.
Excuse me, Chief Hamilton and, Deputy, I don't have a name, but the next person, please escort them out. Thank you so much.
So I'll just, add a few components, or a few things at the end, and I know, Mr. Coles mentioned it, but I'm sure that people will talk about parent choice in this discussion. One of the things that we are very much concerned about are some parent choices. We know that we have parents who have tested positive and have driven their children to school and left them at our school. We do appreciate that the masks were there because this helped us as far as making sure that we can slow the contagion as well as hopefully reduce our quarantines. I'm also asking families who are watching, if you are positive, please do not bring your children to school. If you have a child who is exhibiting symptoms and you've taken your child to get tested, please do not take them to school until you get the results of the test. These are all the components that we're dealing with, and this is why I think it's important that we have the masks, because we are not having everyone following the expectations and the rules of how to keep this from transferring. So I actually now leave this to you all to determine what you would like to do with the mask mandate.
Madam Chair.
Dr. Simon, we have tons of citizen input, before we make any decisions. We need. All right, go ahead.
Thank you, Madam Chair. I move that we extend the current mask mandate for Rockland County Public Schools, students K through 12, for an additional 8 weeks.
Second. All right, at this point, Attorney, I would like to go now before taking the vote. I'd like to hear from the citizens. And we have, I want the other citizens to know that you are not, speaking to this motion or to this action item. You will still be heard, but at this point, I need to hear from the citizens that have, asked for a request to speak to this action that we are now involved in. So I don't want you to think that we're not gonna go back to the first citizens. As far as telephone calls, I think I have enough people right here, and I'll probably halfen it because I have 50 right here. And so I'll probably halfen it, go to a break, and then come back to hear from our telephone callers.
Yes, ma'am.
Now I have more than 50. Starting with, I want to say Christine Koopman, and as Ms. Koopman is coming up, I'm going to ask Dr. Megan Briscoe, maybe to go over to this, podium so that we can work both. Ms. Coopman.
Hi, thank you very much. I know that how you're gonna vote, and I know that you don't really like hear this, but I'm here in support, I don't care if masks work or not, I really don't. I'm here in support of parental choice over their children's bodies in school. I think any parent who wants their child masked should have that option. Parents who do not want their children masked in school have that same right. But I'm going to read a list of symptoms that local pediatric counselors, school counselors, and mental health professionals are seeing related to forced mask wearing in school. Please listen with your heart to these words of clinical observation. I'm going to speak quickly. If parents are okay with this, totally fine with me. Clinical observations regarding mandated mask wearing: social, reluctance to go to school, fear of taking the mask off for breaks to breathe, fear of what others will think if they don't have their mask on, fear of others who are not wearing a mask, difficult to hear the teachers and students, difficult to tell emotions of teachers and students, social withdrawal, getting in trouble more at school with mask infractions and behavioral issues changes, and indicators of empathy for others. That is when they're talking about other children. Emotional problems, sadness, withdrawal, irritability, sleep disturbances, changes in empathy, changes in appetite, increase in anxiety symptoms, panic, increase in obsessive compulsive symptoms with intrusive thoughts, hypervigilance, repetitive behaviors, and social isolation, increase in stress. Several children have stated something similar to school used to be simple. Sensory difficulties with children with learning disabilities and those on the autism spectrum disorder. Cognitive problems, inability to see the teacher's facial expressions, leading to a decrease in social mirroring. This is very concerning for all age groups, particularly those for children who are nonverbal. Many K-12 students remark something similar: I can't tell if my teacher is being sarcastic or trying to teach me. Inability to concentrate, difficulty focusing, physical complaints, difficulty breathing, unable to take a deep breath, headaches, nausea, fatigue, excessive sweating, fog, ankle glasses, dry eyes, difficulty concentrating, rashes, acne, facial coverings. As far as academic losses, well, that's just incalculable at this point. So I just want you to know.
Thank you so much. And while Dr. Briscoe is speaking, Dr. Kaplan, you come up to this podium.
Hi there, my name is Megan Briscoe. I'm an immunologist who recently, in the past 3 years, has started specializing in pediatric immune development through the study of organ donors. So what that means is I collect immune tissues from children who have passed due to accidental or incidental death. What that means is I hear a lot about what happens to kids that causes them to end up with their organs in their physical hand. And parent choices are often involved. Either accidental choices, we didn't observe our children when they were swimming, we forgot to do something, we didn't buckle them safely, and on purpose choices. Those are the ones that haunt me the most, is that some parents hurt their children on purpose. So the consideration of parent choice needs to consider that not every parent makes the right choices. And so we need to make informed decisions for all of our children, not just my children, not just your children. All of the children here are affected by this because we share the same air. I won't see COVID deaths in my hands because their organs will be too ravaged for me to study them. What I do see is children who have suffered. You can see the indelible marks of trauma and tragedy on them. I am happy to hear people advocating for children's mental health. I don't think that masks are easy for anyone. I've been wearing one for 18 months as an essential employee at UF. On call 24/7, talking about the deaths of children. I don't want to hear any more from this. We can do something to stop this. We have been, and I thank you. I don't want to hear about any more kids in our ICUs struggling to breathe. That's all I have to say. This is extra time.
Yes, thank you, Chair McNeely, members of the board, Dr. Simon, COVID response team. I'm here tonight to deliver to you this community thank you letter. This letter was signed by now over 1,700 community members, teachers, parents, guardians, students in your school, staff members. And what the letter says basically is thank you for doing your best to protect our students, our teachers, and our staff. So I'll read it to you, and then I'll give you a couple of comments from inside. It says, we, the people of Alachua County, are supportive and grateful to the leaders of Alachua County Public Schools and the School Board of Alachua County. Our local community, medical community, and scientists came out in full support of universal masks, and we're so thankful that you listened to the experts. The decision to keep our community safe by implementing universal masking should have been easy, but with the threats to cut state educational funding and even your salaries, it was a brave decision. It's up to our local leaders clearly to put our community safety first. So I just want to say again to the school board, to Superintendent Simon, to the district COVID response team, thank you. We see all the work you're doing. We support your brave decision. We stand with you and we urge you to stand by that decision. So we, the signatories of this letter, fully support you. We'll do whatever we can to help support your efforts to make the rest of the school year as safe as possible for our family, children, faculty, and staff. I ask you to take a look inside that letter where there are over 800 deeply personal and individualized messages of gratitude to you all. It's an outpouring of heartfelt thanks and relief, and it's an indication of just how important and supported your decision was. I'll read you a few of them. There's 800 there, but here's one from a teacher. With tears in my eyes, I thank you as one of many teachers in the district who feel it's our duty to protect each child and protect staff and their families. From a parent, thank you for valuing my child's health and wellness. Your courage to do that is saving lives. Remember that. From a staff member, your sacrifice shows you're truly in it for the children and staff. And from a student who I will out her identity, my daughter Sylvie Kaplan, thank you for keeping me more safe. Thank you.
Citizens, I'm going to call several names, and you can line up at either podium, please. The next 5 people: Audrey, it looks like Quinos, Audrey Clerk, Aaron Sermon, Megan Straley, I beat the sorry, Straley. Kristen Thompson. Tracy Amberbright. And it looks like Brianna Lopez.
Hello, my name is Audrey Kirk, and I believe that we should extend the mask mandate. I'm a ninth grader at Eastside High School, and I've already been informed that there have been 2 positive cases at my school and several at Beacles. This virus spreads fast, and you can count on there being more positive cases. If I have to quarantine, I will be missing valuable days of school and learning. I know that children don't get that sick, but I don't want to be sick at all. I don't want to have to quarantine and have days of work to make up. Or my teachers having to quarantine and no one teaching anybody at all. I ride the bus, and almost every day I have to change seats and sit with someone new. There's so much exposure at school that masks are really the only thing keeping us safe. Thank you.
A mask isn't just a mask.
Please give your name.
Oh, my name is Erin Simarani, and I'm a mother of 2 Alachua County school children. It's my first speech, so please forgive me. I'm not familiar with the formalities. Our face is our avatar we use to present to the world. It's how we connect in our communities and society at large. It's how our children determine if somebody is safe to interact with, whether somebody is happy or angry. This is not a minor detail. If we are faceless, we lose our humanity. Our children are the most vulnerable among us. It is our job as parents to be their guardians, to guard them against harm by whatever means necessary. Since when did it become our children's responsibility to protect the adults that they interact with? Why don't we place this burden upon their shoulders? There are psychological, physiological, social, emotional consequences to masking children. And since you all love your credentials and experts, I am quoting Dr. Marguerite Gris-Prison. I encourage you to look her up. She's an MD, PhD, a consultant neurologist and neurophysiologist with a PhD in pharmacology, with special interest in neurotoxicology, environmental medicine, neuroregeneration, and neuroplasticity. And this is what she has to say about masks and their effects on our brain. The rebreathing of our exhaled air will, without a doubt, create an oxygen deficiency and a flooding of carbon dioxide. We know that the human brain is very sensitive to oxygen deprivation. There are nerve cells in the hippocampus that can't be longer than 3 minutes without oxygen. They cannot survive. The acute warning symptoms are headache, drowsiness, dizziness, issues in concentration, and a slowing down of the reaction time. However, when you have chronic oxygen deprivation, all of those symptoms disappear. Because you get used to it, but your efficiency will remain impaired and the undersupply of oxygen in your brain continues to progress. We know that neurodegenerative diseases take years to develop. If today you forgot your phone number, down in your brain would have already started 20 to 30 years ago. While you're thinking you have gotten used to wearing your mask and rebreathing your own exhaled air, the degenerative processes in your brain have already begun and are getting amplified as the deprivation continues. For children and adolescents, masks are an absolute no-no. Their brain is incredibly active as it has so much to learn. The child's brain is thirsting for oxygen 1 more minute. The metabolic...
I need help. I need help.
We don't need a clinical study to know that these are harming our children.
I need help.
Anything that comes with risk should never be mandated.
Alan, we'll take some callers, as soon as these citizens finish. The last name of that person? Okay. The last name is Lopez. Okay? All right. Ms. Thompson?
Right. I'm very proud of our community and school district's response to COVID. The professionals here today have nothing to gain by speaking the truth. Now we need to continue to do what's right without fear of retaliation. Last meeting, I shared a recent photo of Peyton. Here's when she received the trach as a baby. This is what you get. A trach is what you get when you have prolonged intubation. Trust me, a ventilator is not comfortable. It is a lot more uncomfortable to have a ventilator than it is a mask. You don't want to see our children like this without knowing that we did everything within our power to prevent this from happening. I share you with this photo with you to see, because I know how it feels to have a sick child. I feel as though Ron DeSantis' executive order and those that are following in his footsteps are negligent and their actions are leading to needless illness, death, and disability. If you as a school board do not continue to implement every precaution you have available to you, then you are also guilty of this. Masks are simple. No child has died while wearing a mask. However, children have died from contracting COVID-19. Based on the comments and actions of parents who refuse to admit COVID exists, mask, vaccinate, or provide any preventive measures, and going as far as saying they would send their children to school, even if they are exposed to COVID-19, means that you as a board must act to protect us kids from those parents. The only exemptions that should be given are for those who truly have medical or developmental reasons. Delta is different. Please continue to implement and exceed all the preventative measures that you have available to you. And remember, this is not what you want to see your child like. You don't want to see your child getting a trach or being intubated, because I tell you, this is a lot more uncomfortable than a mask.
Thank you. And after Mrs. Lopez, we'll have Amber Bride is going to be next, and then Ms. Lopez, and then citizens. We will go to calls, and I will then give other names that Mrs. Johnson and others outside can help up. All right? Well, just a minute. May I have your name again?
Megan Straley.
I did call you. Thank you.
You did. Is it my turn?
Yes, ma'am.
Okay. I brought gifts. This is my first time. I'm sorry. My kids know that when I become angry mom, they straighten up. Obviously, I'm angry mom, and you guys don't know that yet. So, you'll have to excuse me. Like I said, it's my first time. I want to thank you for making this a national platform, because we as the parents are standing up against this. And I want to thank you for bringing me out into the open, because last year I was quiet. Last year I went along and I played nice, but we are 458 days into this. We haven't slowed anything, and we haven't stopped anything. And your idea is to relive Groundhog Day for the 31st time, the 32nd time, the 33rd time. That's not going to work for me. That's not going to work for my kids. And that's not going to work for a lot of parents who, like me, are here for the first time, standing up to a board that is now have federal interference from our president, who has no business. It is against the 10th Amendment for him to stick his nose into local affairs.
I fought for my school. I bought my house for that zone. I took your attorney to court with me for a contempt motion at my expense, and I won. So I could guarantee my children stay in the school that they are in, and I will not sit down and watch you take our rights away from us. No federal, state, or local government or any official of such government acting under the color of law shall interfere or usurp the right of a parent to direct upbringing of the child or parents. And it is very clear to tell you that it needs to be least restrictive if you do. This is a letter to Wilton Simpson and Charles Sparrow. Anybody that wants to demand a session, you see me.
Is there any way, from the commission here where we can mute?
Oh, gladly. Have a nice day. I CC'd you all in on a copy.
Is there
Anybody wants one?
Is there just a minute. Is there any way, other than on the phone, that we can mute a citizen when they can't stop?
We are, if they keep yelling, unfortunately the room is small and we can hear them, but I'm gonna be going out to the DVD room.
Thank you so much. Deputies, I need all of you in here. Ms. Amber Bryant.
Good evening.
Oh, I can tell, but it's, you can unmute now.
Appreciate you. Good evening, Dr. Simon, Dr. McNeely, board. Thank you very much for doing this. I first want to express my extraordinary gratitude for the 2-week mandate and for the personal risk you have all taken, not only in your salaries being threatened, but I would be surprised, although I don't know, but I would be surprised if you haven't been threatened in other ways as well. And for that, I thank you for putting the children in our community ahead of yourself, because that's difficult to do. So thank you. Please pass this 8-week edition. I didn't know I would have a chance to say such a thing. A previous speaker brought up autistic children. I'm a mother of 3. One of them is autistic. He thinks his mask is great. He's 16, very, very well able to argue with me when he disagrees. Okay? Is he the only autistic child? Is he a monolith? Of course not. Of course not. But I've heard it brought up before, and I always wonder where this is coming from, because all the people I know within the autistic community, they all have different things, like us. And there are different ways around it. I don't see children struggling with a mask unless they've been told to struggle with a mask. I am not a scientist, therefore, I'm going to listen to our scientists, and I hope you do as well. Thank you so much. Thank you.
This is my daughter Isabella in 2012.
Would you state your name?
I'm Christina Lopez. Oh. This is my daughter now. She's a student here in County School Board or system. Although what I have to say is about one student, I came here to speak on behalf of all children. My name is Christina. I have 4 daughters in the Alachua County School Board system from ages 4 to 10 years old. I have to admit, I do come here with a very biased opinion. I come here as a parent of a child who spent birth to 469 days in the pediatric ICU connected to ventilators and other breathing machines. They helped keep her alive until she had her life-saving heart and lung transplant right down the street at UF Health Shands Hospital. Bella is now almost 9 years post-transplant, and she's doing awesome health-wise and in school. She has worn a mask to school since starting VTK. Pre-pandemic, her sisters voluntarily wore face masks when they had a lingering cough and had to return to school, because as they would say themselves,
They didn't want their friends to get sick. Imagine at 5, 6, 7 years old, wanting to protect your friends from the common cold. Now, as 5th, 4th, and 3rd graders, they wear those masks with the hopes that one day they won't have to. Masks are so important. It's a community effort. I'm sure we all understand the benefits of mask wearing. I never knew before my experience, my personal experience, that I would live the life of a child with the life of a child that has complex medical needs. Nobody ever expects it, but if we can avoid our children being placed on a ventilator, wouldn't we do everything we can to protect them? We need to mask children, check temperatures, ask the kids if they're feeling okay before they send them to school, and social distance when it's possible. Making our children temporarily uncomfortable is worth every bit of their lives.
Thank you so much. Before we start with our calls from home, I'd like Dr. Carrie Wells to be prepared after our phone calls. There's a name of just Carrie, no last name. Joey Jett, Brittany Jett, and Jonathan Green. And now we'll take our calls.
Yes, ma'am, and how many phone calls would you like to take?
5.
Adam, you can give us the first 5 callers, please.
Absolutely. The first of our callers is Mary Benedict. Ms. Benedict, you have 2 minutes.
Thank you. This is Mary Benedict, President of the Alachua County Council of PTAs. Good evening, Chairman Neely, board members, and Superintendent Simon. With over 50 speakers tonight, I'll try to be brief. ACCPTA is incredibly grateful that you bravely prioritize the health and safety of our students, teachers, staff, and our greater school community by enacting a mask mandate for the first 2 weeks of school. As local COVID infections and hospitalizations continue to surge and our local hospitals reach capacity, ACCPTA wants to echo the calls of the medical professionals who spoke here tonight and ask you to continue to follow CDC guidelines, which include the continuation of the mask mandate, helping to keep our schools open and our students learning in person. As always, we continue to stand ready and eager to work with you to help facilitate communication, resources, distribution, and family engagement in our county. Thank you so much.
Thank you, Ms. Benedict. To all our callers, we will be limiting you to 2 minutes, at which time I'll be shutting down the mic. Tina Days, you have 2 minutes.
Hello, can you hear me?
Sure can.
Yes, I am in support of keeping a mask mandate to protect our kids, and I do want to give kudos to the school board for fighting for our kids. And I was watching CNN this morning. I noticed the story that came up on the news, and it touched me. And it's about a story of a 13-year-old girl named Michaela Robinson. A Smith County teenager passed away from coronavirus complications on Saturday, August the 14th. Michaela Robinson, 13, was an 8th grade student in Raleigh. Last week, this time, she was getting her daughter on the bus. And this week, she is planning a funeral, said Dr. Flora Strickland, a friend of the family. She went to one hospital and was moved to another, and we got the news that within an hour, she had passed away. Students are grieving today. You know it's going to be different. Some of those students are still quarantined, so they haven't been able to come and walk the halls. We had extra counselors today, and those counselors called Michaela's grade level out to talk to them about the grieving process. Stacey Hughes, principal of Raleigh High School. School years that Robinson attended classes most of the week before feeling ill. A post was made Saturday on the Raleigh High School Lion Pride Band's Facebook page that read, "Every teacher loved her and wanted 30 more just like her." This comes just weeks after the school's band director lost his battle with COVID-19. Students returned to class on August the 6th, and masks were not a requirement. However, within the first few days of school, 76 students and 11 teachers tested positive for the virus.
Alrighty, sorry about that. I hate doing it, but Shanae Jackson, you are next and you have 2 minutes.
Hi, as I stated, my name is Shanae Jackson. Let's write this day down in history. So this is the day that Dr. Paulson and I agree on something. One of the things that he said in the beginning of this meeting, and we need to listen to each other. I sat and listened intently to both sides. And what I realized is that we have one side that ignores all of the facts that they don't want to be ignored. And that's not okay. Literally, the reason that we're having this debate is because we need to take care of each other. Then we have another side who believes that their choice is more important than the health and safety of the folks. One parent actually stated, when it become her child's responsibility in order to protect the folks around them. It's all of our responsibilities in order to protect each other. The fact that we heard that there are parents who are COVID positive taking their kids to school, the fact that we heard that there are parents that actually take their kids to school with COVID symptoms is one of the reasons that we actually need to wear the mask. Some data has actually shown that there is a 30% reduction in transmission of COVID if both people are masked. I think it is extremely interesting that some parents cite things like children with disabilities as a reason not to wear the mask. Children with disabilities, and I have a son that's on the autism spectrum. If it is that imperative, they can get a medical exemption, and we must be clear on that. Additionally, I want to point out that nonverbal communication is actually the primary form of communication and not being able to see someone's face. We've always been effectively able to do it. I also want to point out, in their sense of the loss of oxygen, surgeons wear masks for hours on end. Being a person who previously worked in the emergency room, in fact, when COVID started, masks do not cause oxygen deprivation. And I think it is reckless that we have so many people that are peddling those conspiracy theories. Additionally, it is reckless to want to cite one physician that supports your position when there's hundreds of others that do not. I applaud the school board of Alachua County, and I don't always do that. I even laugh at the mom that said she's an angry parent. She hasn't seen us
Jackson, gotta let you go. I'm so sorry.
Thank you, I appreciate it.
It's okay. I'm sorry about that. Okay, our next speaker is Ms. Tiffany Ward. Ms. Ward, you have 2 minutes.
Hi, thanks for giving me a moment to speak. First of all, I'd like to ask why on earth Ms. Shanae Jackson has any comments and why she's even calling in. Wasn't she all over Facebook going to UPS store when she had COVID out in public? She has no right to be speaking about that. Plus, she was no Ocala, so, you know, big deal. If you're calling on behalf of the board or if you're there in person to support the board, I don't know why you're even there. You're a committee member breaking the law, and shame on you. You have no say in the care of our children. You are not their doctor. We are not seeking your consultation for their care. You are not welcome here, and we need to stop. It's glaringly obvious that you and your time and your so-called opinions have been bought and paid for, so please just stop. As to the board and the superintendent here in Alachua.
Next call.
You're treating these children with special needs with, you're just bullying them. You're bullying their doctors. You're calling their doctors and trying to verify their exemption letters. You're harassing doctors because they are trying to speak up for their children that they care for. Shame on you. The superintendent should be removed for breaking the law. Many parents last year didn't want to make their child wear a mask, but they complied to obey the rules. When rules didn't matter, when rules don't matter anymore, you are creating chaos and division in the community, pitting parents and community against each other. Simon is responsible for the chaos in this community. She has used this opportunity to be on CNN and every other major news broadcasting opportunity. She gets fined. She's made friends with Biden. Shame on you. Shame on you for putting our children at risk so that you can further your political career.
Before the next caller comes in, you told me before we started this business meeting that you have a system to mute. I would like for you to do that when the time has shown that the speaker is done.
Yes, ma'am. There may be a bit of
Clock moves to 2 minutes exactly.
Yes, ma'am, there may be a little bit of a delay between what you see with the light here and when the speaker starts talking and Adam starts timing it, because it's not instantaneous.
When Adam starts counting, I'm gonna give him 5 seconds, and then I'd like it to be muted.
Adam, did you hear that?
Yes, ma'am. Yes, sir.
Thank you so much.
Last caller for this round is Joe Beatty. Ms. Beatty, you have 2 minutes.
Good evening, board members. I just want to say thank you very much for all your efforts and your well-reasoned, well-researched position. I know that you had the best interest of all of our students, your staff, and all the employees at Payment. And I want to thank you. I know it's not an easy time for any of you, and I'm not going to take up any more time. I just want to thank you very much, and I know you will make a thoughtful, well-reasoned, based on science decisions. Thank you.
Thank you, Chair. Madam Chair, back to you.
Thank you so much. And I've already called the names, so Dr. Wells, come to one podium. Carrie, the next. Joby Jett. Jonathan Green. Brittany Jett. After these speakers, after these citizens, if it's at 8 o'clock, we'll take a break. Yes, ma'am.
Okay, hi, my name is Dr. Carrie Wells, and this is actually the first time I've physically come here. I've called in before. I'm here to discuss freedom, because I see a lot of people who are in church with freedom and talking about freedom. There are certain freedoms I value as an American. Freedom to earn a living, to support my family, protect my health, send my children to our neighborhood school, and protect my whole community. And the only way I can protect these freedoms is to follow science. Last year, I taught 19 second graders using the HiFlex model. I had 11 in class with me. And this year, I'm teaching 18 second graders, all working order. And not once has a child complained about wearing masks all day long. They might need a 1-minute break to go ahead and let them step outside, come back in, but that has not been a problem in my class. Children are wonderful, they're compassionate, they're resilient, and they care about their friends' well-being, and they like to learn in a safe environment. They understand why we are masking. Almost daily, I receive emails saying that at my own children's schools, they have COVID cases. As we know through research, my mask protects others. I wear it because I care about my community, and the only way to minimize spread is for everyone to wear masks. I love to teach. I love to have my own children in public schools, and let's keep the rest of us safe. Let's keep us safe this whole school year to protect our freedom to work and our freedom to receive a public education. We're here for the kids and their teachers, and I'm just asking that we do continue the mask mandate. And I also just want to give a shout out to transportation, because I could not do my job as a teacher if I did not have them safely bringing their children, our children to school. So thank you, everyone.
Hi, thank you for allowing me the opportunity to talk. My name is Dr. Cardi Basso, and I'm here to talk about that to point out that the only mask that has shown any efficiency in stopping virus is the N95 properly fitted mask. So these masks that we're wearing do nothing, and if you're going to insist on masking our children, then you need to be supplying every child a fresh N95 mask every day. Otherwise, you're not doing anything. But I'm also here to talk about parent choice, because I'm very upset that you're dismissing children through the Hope Scholarship. The Hope Scholarship is meant to remove your child from a school that they are suffering under. And my children are not suffering under their schools. I don't want to put them in a private school, and you can't put them in a neighboring county school. Neighboring counties do not accept children outside of their own district. My son goes to McBain Middle School, and I have had children that were at Santa Fe High School, View Hills High School, Irby, and Alachua County, and not one teacher was somebody that I didn't like. I have loved every single teacher. The previous superintendent did a super job hiring these teachers. I really appreciate that. I don't want to pull them out. My son in Lebain has amazing opportunities through the AG program, through the AVID program. Right now he's in Spanish and he's in advanced math, and he's gonna have 2 high school credits by the time that he finishes middle school. Why do I wanna pull them out? You're the problem. You're the one that is breaking the law, okay? That was signed by the legislature. So I have the right to keep my kid in a school that he's happy with. He has his friends. I like the teachers. I don't have any problems.
Thank you so much, Dawn. Mrs. Jen?
Good evening. My name is Joby Jett. I live in High Springs, Florida. My wife and I both grew up in High Springs. We attended High Springs Community School back when it was High Springs Elementary and Springville Middle Schools, which were invested in our area, our community. We now have 3 children enrolled there. We're all looking forward to a more normal school experience this year. Mainly in-person education with masks optional. As of today, my children have been in class 1 full day. My wife and I signed a mask opt-out form as allowed by the governor's emergency order, the recently passed Parents' Bill of Rights, the Florida Department of Health emergency rule, and 2 Florida Department of Education emergency rules. We've submitted this form repeatedly, but each morning my children were turned away and denied their education. Each day I've been told to talk to the school board and superintendent. Each day I've called and emailed asking for some response from the school board or the superintendent. So far, I've received nothing but an email from Chairman McNeely. Thank you for it. However, it was dismissive, did not give me any more information, did not answer my questions. I did also receive a phone call from someone in the superintendent's office, but they were either less than informed or less truthful than they should have been. This board stands in violation of the law, direction that's been given to it by the governor's office, the state legislature, the Florida Department of Health, Florida Department of Education. A law that is being followed by 65 other counties. My wife and I want our children in our classrooms. My children want to be in their classrooms. And you won't even have a discussion with me about it. Your silence speaks volumes.
Brittany Jett?
Hi, I'm Brittany Jett, Joby's wife. I am an RN and a mother of 4. 3 of them were enrolled at High Springs Community Schools. Are we a house divided? I am not against masks. I am not against immunizations. But I am pro-choice. And so is our governor, so is our entire state legislation, the Florida Department of Education, and the Florida Department of Health, which has been quoted here tonight. This school board is refusing to acknowledge our rights as parents to make these choices. And it's violating the law by requiring a doctor's signature to do the mask off form. This school board is also promoting the Hope Scholarship for anyone who disagrees with them. The Hope Scholarship was not originally designed to protect kids and families from a bully school board. I voted for every one of you guys sitting up there tonight, and you would love to push us just out of the county. We signed and submitted the forms for our kids, as is legal, and for 5 days in a row now we have gone through the process of getting up in the morning for school, packing lunches, backpacks. We go to school, and we're told no, we have to leave immediately. When we ask why, they tell us to call the superintendent. And when we have reached out to Carly Simon and the rest of the board, we are met with silence. I have not heard any response back from anyone. Each day we've called and emailed. Dr. Simon won't even take the time to email us back. That sort of laziness, shrewdness, the reclusiveness, that leaves me to question the authenticity of what she's pushing for. We're following and choosing the law, and you guys choose not to. And our kids have been the victims of your lawlessness. And I'd love to bring up, is PK Young, do they have to have a mask mandate, or does they get the option? PK Young gets the option. The one school in the county. Your bravery and everything else. Yet one school that's headed by the University of Florida, they do not have to wear masks if they do not want to.
Thank you so much, Ms. Jett. Jonathan Green?
Good evening, Superintendent Simon, Madam Chair, members of the Alachua County School Board. My name is Jonathan Green. I'm the cousin of Opal Green, a child who's removed from school for not wearing a mask, and I'm an incoming senior at the University of Florida. When I heard the news of my cousin being removed from our school for failing to comply with an arbitrary mask policy placed by this board, I was moved with a deep sense of dread and fear, and I believe this arbitrary mandate of the board is both an overreach of power and a neglect to the duties of the children. As stated in Section 4, Article 9 of the Florida Constitution, the board is responsible for the organization and control of the public schools of the district and is empowered to determine the policies necessary for the effective operation and the general improvement of the school system. I asked this question to the board: how does removing a child from her classroom for failing to comply with a mask policy that is arbitrary, loosely grounded, and arguably unnecessary aid in the effective operation and the general improvement of the school system? Given the lack of efficacy of masks on children proven by studies done by the University of Florida, Brown University, and the actions of the school board, I believe the actions of the school board unwarranted and disgraceful. These arguments you have heard today about the efficacy of masks is a red herring. The real issue here is whether or not the board possesses the political power to remove a child from his or her education institution for not wearing a mask against the will of the parents, to which we must look again to the responsibility and powers of the board. I believe it is gross overreach to allow any person on the board or the board itself to arbitrarily decide that a child must be removed from the education institution for not wearing a mask against the will of the parents in the name of safety. It is outside the scope of your power to remove students from their school, and it doesn't matter what you think, whether the parents are wrong. If the parents' decision is the parents' decision. Superintendent Simon, Chairwoman McNeely, and the board are obligated to apologize to Ryan Green family and issue a statement to all Alachua County schools.
Before we leave the auditorium, these are the next citizens that will come forward. Adriana Keene, Carmen Ward, Thomas Green, Stacy Cooper, and Candace Jones. We will reconvene at 8:10.
Yes, ma'am. Thank you,
I think I met you at Metcalf, didn't I? The Metcalf Wall ribbon cutting. Were you there?
I wasn't. Was I at Metcalf? No, I was at
Or Howard Bishop?
I wasn't at Metcalf. That was my coworker. I think.
Oh, okay.
I normally don't go to the ribbon cuttings, but there was one I went to. Actually, it was Metcalf. You gave me the clock.
Yes. Okay.
That's right.
You look familiar, so I thought
That's
so.
right. Yeah, it was. I normally don't go to the ribbon cuttings, but I did go out that day. That's right. I can't remember the name of the school. Yeah, I can't tell. I'm like, am I in your way or not?
No, you're really not. I'm basically shooting that podium back this way, so you're perfectly fine.
Got it.
Yeah.
Seems like it's gonna be a long night.
Yes. Yeah, I'm actually just streaming this to YouTube, so.
Yeah, I'm thinking that because I have to get this all in for the 11 o'clock, so I'm thinking I'm gonna have to watch the rest on YouTube.
All right.
But I'm gonna stick around a little bit. What's your name?
I'm David Stanley.
David Stanley?
Yes, ma'am. Yeah, I work for the school system.
Perfect, David. You can call me Tia.
Tia?
Tia.
Okay,
yeah.
hi,
So
Tia.
when I see you again.
Okay, thank you.
I'll be back.
Thank you. I'm CK Young. Let me ask you something. What kind of fun things are you doing?
It's going great.
I told my wife today, we said this. There's a guy in Texas, you know that guy, shooting. 10 days ago, he's still waiting for an operation on his shoulder. Because they can't get to
Adriana King, Carmen Ward, and then, I'm sorry, you have a medical exemption? There's some masks next door. There's some masks next door, so she's able to come in as long as she has on mask.
Still fine. Addressing this to the medical board. Still fine.
So what did you say? She doesn't need a mask, maybe she does have a mask. Okay, thank you.
Are you submitting this to the?
Oh, it's already been submitted, that's my extra one.
That's your copy.
Thank you. The time. Okay. I am sorry, Ms. King.
That's okay.
Okay,
Are you
you're
ready?
on.
I just want to apologize, I think I filled out the original form incorrectly, this might have been under action 1. So, just let me know, it's still all related, don't worry, it just might be a little bit more towards action 1, because I also have a mask. So I just wanted to, am I all right to start?
Go right ahead.
Okay, I just gave you guys off the front of your ledge, is the CDC guidance for how to keep kids healthy at school. It says, the #1 way to keep kids healthy is to wash their hands for at least 20 seconds. I think we all can agree on that, right? That is the #1 thing. So if you look at highlighted, it says before lunch, after playing outside, that is the best time. And if water is not readily available, hand sanitizer or 60% of alcohol will suffice, correct? I think we all can agree on that. So I started talking to my kids, and I started realizing kindergarten, first grade, second grade, all go out to the playground first. They grab their lunches, they go out to the playground, they play, they walk into the cafeteria, they go, 1, 2, 3, 4, here you go, go eat. Why in a 2-year pandemic are we not washing our children's hands? And it is not the teacher's fault. They don't have time and they are not given the tools. Why, if you look at the last page, are we not providing a simple PVC wash station outside each of our cafeterias? It's simplistic, it's cheap, And I think with all the money that we got from taxpayers, maybe the extra fund, however it worked out, we could have provided these families and these teachers a decent way to wash and teach these kids how to properly wash their hands. Masks are as only good as the ones you have and the ones that you wear and how you really wear them. It has proven after COVID, we're still going to have strep. We're still going to have the common cold. We're still going to have all this stuff. We need to be washing our children's hands before they eat. Okay, that was my action one. Action two. I heard the complaints about masks. I have a son who has an IEP for vision. He was with Peyton in class. I understand. My son needs to have a mask off. He is legally blind in an eye, born with a cataract, had his lens removed, and where he cannot patch.
Thank you. Ms. Ward.
I'm Carmen Ward. I'm the president of the Alachua County Education Association. Good evening, Dr. Simon, Dr. McNeely, and board members. I want to say thank you so much for being responsible, for being wise, for being brave, and for keeping children and staff and teachers safe in Alachua County. And I'm here to represent myself, but we also have support from the Florida Education Association, the National Education Association, and the American Federation of Teacher Presidents have all said they support your brave actions in doing what is safest for children here in Alachua County. And with that, I do want to say that we have a teacher shortage. And I am the elected voice for the educators. We have a bus driver shortage. We have staff that would feel very insecure right now with the surge of COVID that is happening if there was anything except a mask mandate in place. We also are encouraging vaccination, and I want to encourage the board to think about COVID leave, because we have right now 10 days of COVID leave for the vaccinated who are testing positive, but we want people to be responsible and to make sure that they aren't coming to work if they have symptoms. And so we do need to think about how we can support that. And I believe we can support it with extensions of what we have in place right now for COVID leave and for child care for COVID leave, because there are so many children getting positive COVID cases. I think we're going to see our state, I know there are emergency meetings going on all over. Yes, I'm out of time.
Yes,
I just want to shout out to all the bus drivers that showed up tonight. We love the bus drivers and all of our union members. Thank you.
Thank you. Mr. Green. Stacy Cooper will be after Mr. Green, and then Candace Jones.
My name is Thomas Ryan Green. I'm from High Springs Community School, and this is my daughter Opal. And all of you are responsible for kicking her out of school the very first day of school. All she wanted to do is go to school and enjoy her friends and her teacher. But every one of you thought it was a good idea to make her wear a mask. Now, I'm going to sit here and tell you, I'm a very pissed off parent, okay? There's not a person in this world that will protect her more than I will. I can guarantee you that. And that goes for every other parent out there. You don't have to sit here and make people do something they don't want to do. Now, you say in the name of safety, but here's the problem with that. That if you sacrifice safety for temporariness, what's going to happen is you're going to sit here and you're going to mess this whole entire thing up. Now, I'm going to tell you something. You have disrespected my child, and you disrespected our wishes as parents. And I don't think that it's okay. I don't think that it's okay to push words like data and science and safety when those things are constantly changing. You say 2 weeks, then you say 8 weeks. Then you go on and say 2 months, 3 months. When does it stop? It doesn't stop. Does it? I don't think it does. Every one of you are responsible to look at both sides, all sides. But all I see is a one-sided thing. That's all I see. Thank you.
Ms. Cooper.
Yes, Stacy Cooper, mother of 6. What I haven't seen proven tonight is the actual evidence that these masks are doing any good. I'm not a conspiracy theorist. I have read over 14, today I read another one, 15 studies that show the effectiveness of masks are not doing anything to an airborne virus. That is what COVID-19 is an airborne virus. So you are making our kids go without air for no reason. There's another study, scientific study, that showed the carbon dioxide level, actual study, in kids after wearing a mask for 10 minutes was twice as high than it's safe for an adult at an 8-hour period. These are the studies you need to be looking at. Another graph came out today showing the schools last year that had mask mandatory and mask optional, and the mask mandatory schools had a higher rate of infection than the mask optional schools. Now all these facts, sure, they're great. But the real problem here is our freedom. We as parents have the right to choose for our child what we think is best. All 6 of my kids have had some of those symptoms that they mentioned tonight. And we're doing that for no reason. There is zero evidence. I'd like for you to put out there the evidence that you have found, because there's not any. This is all about fear and taking our freedom away, and we are not going to stop.
First, let me explain why I'm here. 2 months ago, excuse me?
Would you give your whole name, please?
Candace Jones. All right. 2 months ago, I moved here. I brought my family here from Minnesota. I spent most of my life in Minnesota. For the last year and a half, I spent time during the COVID with my kids having to wear masks at school. And I also had to deal with riots. I had to work 15, 20-hour days fighting riots in the cities. As a police officer, I retired early, left my profession, brought my family here. So I can tell you I'm disgusted and disappointed with what I see. If I had known before I bought my house that this is how Alachua County is, I would have bought it somewhere else. My child will not go to school and wear masks. I gave it 2 weeks. If you guys do this, she will not go to school in Alachua County. I will find a charter school, a private school, or a home school. Because the damage that masks do to children lasts a lifetime. High blood pressure, cardiac issues. When a child wears a mask long-term, short-term it's okay. To the grocery store, running over to a hospital, nursing home, whatever. But for 7-8 hours a day wearing a mask, long-term effects. And we're going to see that in 10 years, maybe even less. That our children are suffering from these mask mandates with major, severe health issues. They're going to last the rest of their lives. There are studies out there. Take a look at the International Journal of Environmental Research and Public Health. 65 scientific papers show that masks they're not for kids, that they do create health problems long term. All right, not only that, they cause fatigue, dizziness, headaches, chest pain, confusion, drowsiness, reduced motor skills, unable to concentrate, decreased thinking ability, decrease in reaction time. So how do kids learn when all this is happening wearing a mask? If they're dizzy, if they can't concentrate, how do they learn? Anyway, I just want to say my kids aren't.
Thank you so much. Before we take callers, I want the following people to hear your name. Laura Irwin, Emily Derrick, Brent Line, it looks like Nicole Paradise Black, and Dee Basso. Now, at this point, I'm going to ask Robin Lilly and I think it's Tawana Jones. They are our bus drivers who have early routes in the morning. We want them to be up and ready to go at 5 a.m. So I'm going to ask that they come next, and then we will resume our other citizens.
My name is Robin Lilly. I'm with the Robert County School Board First Sergeant. I've been on for 21 years. I started here.
Pull your mic down, please. Thank you.
And I'm speaking on behalf of my family, my First Sergeant Down Transportation. We chose this job. It's a passion for us. It takes skill and patience to drive a school bus. Safety is number one, and we do it with care. So when we start to issue out funds, all we ask is that you be fair. We are essential workers, and we're entitled to livable wages. As we transport children daily from all walks of life and all ages. So please continue to keep us safe from COVID and extend mandatory masks. Have plans in place for gang violence on buses. Just a few simple tasks. We're your children's first contact. We're teachers, we're guidance counselors, to some, even a friend. So please, please extend mandatory masks in schools and on buses until this pandemic ends.
Mrs. Jones. She's not here at all.
Okay, would you like to take another 5 callers?
I did do that already. Now. Oh, you have.
5 callers from the phone.
Yes. Thank you.
Okay, Adam?
Excellent, sir. And Madam Chair, the 5 that will take in order are Shane Gibbons, Darlene Tucker, Sabrina DeSue, Joshua Irwin, and Stacy Scott in that order. First up, Shane Gibbons, you have 2 minutes. Shane, you got there? Shane Gibbons. And to our next caller, Sabrina DeSue, Darlene Tucker, I'm sorry, Darlene Tucker, you are our next caller.
Hello, my name is Darlene Tucker. I'm just a nurse and a member of the community, and I want to thank you so much for your strength and steadfastness in keeping the well-being of Alachua County and its students in your focus, despite tremendous pressure on you all. I've never been prouder to call Alachua County home. My request is to continue the mask mandate 8 weeks longer and to continue for opt-out notes to be physician and healthcare provider generated. Please don't compromise on that and allow parental written notes. I know the governor's belief is parents know best, but why wouldn't the physician to whom they entrust their care on a daily basis be an acceptable option for them? Surely trust has been established, so there should be no issue with their physician notes. Personally, to me, it's risky behavior having any unmasked kids in the classroom, but anyway. So please keep the mask mandate, keep the physician-based notes. My nurse buddies are getting really, really weary and very unappreciated. So again, thank you for the input, no matter how wacky, and we have seen some wacky, the vast majority of the community is behind you. Thank you very much.
Thank you, Ms. Tucker. Next up is Sabrina DeSue. Sabrina, you have 2 minutes.
My name is Sabrina DeSue, and I appreciate the superintendent and the school board members for mandating the mask, and I think that we should continue wearing masks. I am a teacher, and I feel comfortable going to work with everybody having on a mask, and it's not the children who don't want to wear the mask, it's the parents. The children have no problem wearing a mask at school. Even kids with disabilities. You have kids with disabilities who remember to wear their mask over anybody else. So I thank y'all and I support you all.
Thank you, Ms. DeSue. Next up, Joshua Irwin. Mr. Irwin, you have 2 minutes. Mr. Irwin? Mr. Irwin?
Yes, I'm here. I think you're muted.
Okay, we hear you.
Can you hear me?
Yes.
Okay, awesome. As a previous speaker mentioned, they mentioned that parents don't make the quote best choice for the kids. And I'm here to tell you that is not your job, your responsibility, or your right to tell a parent what the best choice is for them. That child is not given to you. That child is given to the parents. The parents are in charge of that child. This is not about whether masks work or whether they don't. This really isn't about masks at all. This is about parents' rights. And I'm here to tell you that you are all on notice, especially Dr. Simon. Commissioner Cornell stated at the beginning of this meeting that you would be removed for not wearing a mask. This is policy, not law, might I remind you. I am calling to have all of you removed for breaking not only policies set forth by the Department of Health, the Department of Education, as well as the law. You all need to be removed, and you are on notice. You will be voted out. Thank you.
Thank you, Mr. Irwin. Our next speaker is Ms. Stacy Scott. Ms. Scott, you have 2 minutes.
Thank you. Thank you, school board members, for mandating masks in school. My son is 11 and a half years old and he cannot yet get vaccinated, so I'm very happy with your decision to stand up for all children's rights by protecting all children. Some of the greatest rights guaranteed to us in the United States Constitution have limitations and exceptions, including probably the right I stand up for the most in my work, which is the Fourth Amendment. Even the Fourth Amendment has exceptions for exigent circumstances and community safety, and I would maintain that a mask mandate in public schools is necessary for protection of all children in our community, and I thank you very much for your decision.
Thank you, Ms. Scott. Our last speaker in this round, Ms. McLean. Ms. McLean, you have 2 minutes. Ms. McLean?
Hello, my name is Isaiah and I'm 10 years old. I go to school here in Alachua County. I'm tired of wearing masks. I can't see my friends. It's hard to breathe, and it's becoming normal that I'm afraid we won't get vaccinated. I don't want anyone to tell me I have to wear a mask, and I've heard our superintendent doesn't care about parents or the law. If the adults don't care about rules, who should be listed that is a good role model to follow the rules? Ever since I wore masks, I've been sad. I'm so sick of wearing masks. Everyone should be able to choose because the board is violating the law and my rights. People have choices for themselves. My parents keep me safe, and I want the school board to be a good role model and follow the law. Thanks for your time. Have a good day.
Thank you, Ms. McLean. Madam Chair, we'll rotate back to you.
Thank you. I've already called the names. I'll call them again. Laura Irwin, Emily Derrick, Brent Line, Nicole Paradise Black. We have 2, and Dee Gosso. And after these speakers, we will have Dr. Tessman, Jessica, it looks like an N there on. Grant Cooper. And James, it looks like Gardell. Ms. Irwin.
Thank you for your time this evening. To quote everyone's favorite expert, Greta Thunberg, how dare you? How dare you presume to care about our children more than we do? This is not an issue of masks, it's an issue of parental rights. And this board is flouting the law. It is unacceptable. You do not have the right to decide what is best for my child or any child in this county.
That is the reason why this weighs so heavy on you and why it is such a burden of a decision. Because it is a decision you were never created to make. The government and the law was created to uphold the rights of the individual, not the rights of this institution or any government body. And the recent actions of the superintendent have spoken volumes to the community and what her priorities are. When she's going around interviewing on national television about how she's defying the governor, and this board is defying the governor, rather than serving the parents and the children of this community. It's unacceptable, it's disgraceful, it's shameful. Instead of actually serving the parents and the children of this community, she's too busy calling the principals and sifting through stacks of exemptions that the parents, with the support of the governor, are allowed by law to sign. We do not need a medical professional to sign the exemption form. These are our children, and the decision rests in our hands. So please, we implore you, stop violating our rights. We will hold this board accountable. Thank you.
Good evening. I'm Dr. Nicole Paradise Black, a pediatrician who takes care of hospitalized children, Associate Chair of Education and Program Director for the Pediatric.
Name again?
Dr. Nicole Paradise Black.
I don't think I. Okay. It's out of order, but that's okay.
Okay.
I did call your name. I did call your name. Go right ahead.
Okay, so I am Dr. Nicole Paradise Black, a pediatrician who takes care of hospitalized children, the Associate Chair of Education and Program Director for the Pediatric Residency Training Program at UF. I'm also a mother whose children are in Alachua County Public School System, and I was at the meeting on August 3rd and want to give you my sincerest thanks, Madam Chair, and the board, and Superintendent for doing the right thing and protecting our children and community with the mask mandate. In the week since school started, we tested over 150 children a day for COVID in our clinics. With this volume of testing, it's shocking, it's heart-wrenching. I have no doubt the situation would have been exponentially worse without your brave actions. UF Health and our community remain in a state of emergency. I'm responsible for the education of over 80 pediatric resident and subspecialty fellow doctors. Given the number of patients admitted with COVID and those in the community, all training programs are officially in emergency status. Our UF Health medical education system is in crisis. Education was forced to be reconfigured to focus only on patient care. All of us at UF Health are engaged in a coordinated effort focused solely on managing this crisis due to COVID. We are all carrying the weight of this pandemic on our shoulders, and I'm seeing burnout rise among my passionate, caring runners and colleagues. I'm a physician, I'm a pediatrician, I'm a teacher. Like all faculty at UF, a teaching hospital, we have dedicated our lives to our learners and to our patients. As a leader for over 15 years, I have long understood the gravity of my work in teaching the next generation of pediatricians. Just like you, through this pandemic, we now carry the learners, our learners' lives in our hands with all the decisions we make. For over 500 days, I've spent every single day worrying about their safety and have fought every single day to ensure my learners have everything they need. Universal masking saves lives, it reduces transmission of this horrible infection. No death of a child or any individual is acceptable when we have a proven public health measure that can prevent it. I leave you with this. You and I walk in the same shoes. From one teacher to another, from one parent to another, from one human to another. I ask you continue to lead the way in keeping our children safe with a mask mandate.
Thank you.
Thank you.
My name is Brent Line. I'm a father of 3, 2 of which children went to Lawton Child Elementary. One's a kindergartner, one's in 5th grade. Their first day was supposed to be fun, amazing, and full of joy. Unfortunately, that's not how it went. My son, who's 10 years old, was placed in the back of his classroom, segregated, and sat alone with no kid sitting on his left, no kid sitting on his right. While the rest of the class was set in twos and threes, all partnered up. That's how they were set. To make it even worse, the class broke out into 4s for a scavenger hunt. But my son was told he had to do it alone. To make it even better, he did eat a lollipop for his lonely scavenger hunt. No child should ever have to feel that. It breaks my heart that you are blatantly breaking the law and disregarding our parents' Bill of Rights. You are teaching the same behavior and morals to your staff and to all the people around you. I shame on you. Disgusting. I'm asking you to acknowledge and accept the parental opt-out in accordance to the law. I just want to leave you with one quote. There's a difference between doing things right and doing the right thing. You may think you're doing the things right, but you're most certainly not doing the right thing.
I couldn't hear you.
Can I ask you a question?
Yes.
Do you, why was your child, did he not have a mask on?
Yeah, I signed the...
Did you have a medical?
I went to the school the day before, turned it in, the principal took it, and then I guess you or whoever called, and we got called in the middle of the day.
To take him out?
Yeah, but they didn't make us pick them up. They just told us not to come back the next day.
Okay,
So we haven't returned.
okay. Thank you.
I'm not sure if I'm going in the proper order. I'm DBAS, so I know, is that okay if I speak?
Go right ahead. Would you give your whole name?
Okay, my name is Dee Basso, B-A-S-S-O. Okay, this past weekend, I was up in Myrtle Beach with some close friends. We started talking about our younger glory days in high school. Homecoming, grammar discussed in full detail. Via Facebook, we showed each other old photos of the gowns we wore to both homecoming dance and the prom. We talked about the dates that escorted us to these events. We talked about our corsages. We talked about how we still keep in contact with our friends from childhood. We spoke of these things like they happened yesterday. These memories run deep and are embedded in our hearts and in our souls. The way things are headed with this school board right now, my son, who's a junior in high school, and his friends, they won't have the opportunity to have homecoming, nor be in the homecoming courts, nor be in the homecoming parade. They won't have a chance to go to prom with their first loves. They won't get to make memories like the ones that my friends and I keep in our hearts and treasure. Not only are you making our children sickly from forcing them to wear masks every day at school, you are taking away their future and the opportunities for them to make memories for themselves. The childhood memories that they will remember as adults will be everybody wearing masks, having zero physical interaction with their friends. Those won't be cherished memories. They will be visions of sorrow and anger that they weren't allowed to make precious memories. You literally have the power and control over our children's futures. So please choose wisely when you discuss all of this and vote on it, please. Thank you.
Frank Cooper.
So one of the reasons why you don't see a lot of doctors signing these forms is for one, they're going to be bullied by the likes of your board and your superintendent if they do. And we heard it tonight when Dr. Simon mentioned that. But also, if it was on the flip side, if you had to have an exemption to be able to wear a mask from a doctor, how many would be willing to take on that liability of all the health and mental effects that that mask has on that child and sign that form? Because there's plenty of lawyers that would line up to sue those doctors in that instance as well. So we have a whole nation of lawyers ready to sue. And so that's why you find very few willing to sign and take on that risk and that liability and that bullying from this board and this superintendent. So why would you risk your medical license over that? Like I say, the flip side would be exactly the same. You have an experiment that's been done in our state. You have many counties that did not mask, that never have masks. Studies have been done, and the evidence is clear. If it was anything different or anything newsworthy, we would have heard about it. There was zero statistical difference. So these masks that you all are wearing, these masks that we are wearing, have done zero difference tonight. This virus is not spread through spitting in each other's mouths. It is spread through aerosols that remain in the air and build up in air-conditioned spaces that are not ventilated properly.
Thank you so much. This one is ready too, okay? You'll,
Do you want to move over there?
no, I want the gentleman behind you.
My name is James Burdett, and first I'd like to comment that if the masks were so effective, this wouldn't have to be cleaned after every masked person walks up to and talks. Okay? I talked to y'all back in May. At that time, after I was done talking, a certain board member said that what I said sounded very threatening. I told you you had an opportunity to do the right thing and to do what the governor had told you to do. Now, we're in a position where our superintendent has decided to play chicken with the governor. You won't win. You're too small. You'll be run over.
Talk a little louder, please.
Yeah, no, I'm being very funny, whatever. So, the reality is, I listened to that board meeting today that Superintendent Simon called in on, and they voted that they would be sending the commissioner to oversee the board in the public schools here in Alachua County. And he would have the power through them to make any changes to enforce the rule of law, which you're shirking, and to audit your books for any political activity that is outside of your purview. Okay? You're playing chicken. It's no longer about your salary. And one of the things that they can do is remove officers. So you're playing chicken, and jobs are on the line. Okay? Choose wisely. Don't extend the mask mandate. Thank you.
Hi, my name is Daishika Narayanan. I'm a parent of 2 children at Parker Elementary, and I myself am a graduate of Glen Springs, Lincoln, and Eastside. I wanted to thank you. 2 weeks ago, you made a decision that was in support of the health of our children. You did this in large part thanks to the advice of our medical professionals who showed up at the meeting, who showed up again today. I want to note that the medical professionals who showed up, I mean, they're extraordinarily busy, and they're still here. They're here and committed to making sure that we do the right thing, that you do the right thing for the health of our children. And I appreciate the vote that you took, and I'm here to urge you to please vote to extend the mask mandate for the health of our children. Thank you.
Crystal Jackson again. Board and Dr. Simons, thank you for your time. Please, and I'm speaking on behalf of the Alachua County Education Association and all of our members as well. Please hold strong in your resolve to listen to the doctors and the science and extend the mask mandate through at least the next 8 weeks. I know you have the backing of the U.S. Department of Education, Florida Education Association, American Federation of Teachers, and the National Education Association. Someone will find a way to pay you. I know it is a big ask to say not to worry about that, but you truly have an opportunity to be heroes here and save lives. As educators, we are bound by law to report instances of neglect and abuse. Students have required vaccines to enter school. Educators have long been tasked with protecting children. Unfortunately, as one doctor said earlier, sometimes from their parents. I would like to echo Carmen Ward regarding COVID leave. As you review the COVID data, please also consider extending COVID leave to all employees and increasing the number of days. Yes, vaccines are one of the best ways to prevent and mitigate the spread of this disease, And personally, I want every person who is medically able to be vaccinated, but by only extending COVID leave to the vaccinated or the medically exempt, we are causing an unnecessary hardship. We desperately need all of our employees to be able to stay home when they are contagious in order to keep each other and our students safe. Please do not make them have to choose between safety and being able to afford food and housing for their families. And I just want to clarify, I think I said before, I'm here fighting on behalf of all of our members, even if we don't all share the same opinions. Thank you.
Is, Jessica?
That was me, I'm sorry.
Okay, all right, thank you. And Rochelle? All right. I'm gonna give names, but we're going to go to our, phone line, but please be prepared. Shay Jennings, Carolyn Weber, Lauren, Anna, it looks like Patrick, and Carrie Gillespie.
Would you like to take 5 more calls?
Yes.
Adam? Would you like 5 calls?
All right, our next 5 in order are going to be Gina Dorge, Wendy Wood, Meredith Beaupre, Janine Clayback, and Dentrell Stark. First up, Gina Dorge. Ms. Dorge, you have 2 minutes.
Hi, my name is Gina Dorge. I'm a small business owner, an Air Force veteran, and a prior teacher, and we have 3 children in the Wasco County school system. I'm here to let you know that if you haven't seen me at the meetings lately, it's because I'm working behind the scenes. I'm not here to address the board because you don't care. I'm here to talk to the community that is listening. Without rule of law, there is no order. When are people in this community going to get upset that this school board doesn't operate with the rule of law? These individuals that are expected to hire teachers to teach our kids are going against their own boss's order. If our own board doesn't listen to their own boss, then why do you think parents should have to listen to you? And even more dire, why should kids listen to teachers? You are setting a dangerous precedent for our children that rules don't matter. You guys are doing more harm by celebrating the defiance of your boss by appearing on CNN less than 12 hours after firing your boss than actually caring about the kids. If it was really about the kids, you would have declined an interview instead of running towards 2 interviews. It shows you exactly who you are. The mitigation measures of masks that you have so easily implemented have never addressed the cons of masks. You have only said you're going to do it. Where are the 2-sided studies? There are cons. Let's not forget this board member is missing 1 representative of his district, and until District 2 is sealed, you are making decisions that affect our community. I'm tired of being nice. Get ready for the biggest headache of your entire life.
Thank you, Gina. Next up is Ms. Wendy Wood. Ms. Wood, you have 2 minutes.
Hi, good evening, Dr. McNeely, members of the board, and Dr. Simon. Thank you for caring for our children, standing up to bullies, and mandating masks for the safety of our community. The science is clear that universal masking works to reduce transmission of COVID-19 because it is airborne. Let's remember, children under 12 cannot be vaccinated as of yet and only have masks for protection. Please extend the mandate for schools and buses. And some earlier speakers brought up the idea of advancement of political careers. As far as I can tell, the only political grandstanding is coming from the governor's office, who is using our children as collateral damage. So once again, board, Dr. Simon, thank you for valuing the lives and well-being of our students and the staff who are putting their lives on the line to make sure that children get to school, have their school day, and return home safely. Please vote to extend the mandate for 8 more weeks. Thank you for your time.
Thank you, Ms. Wood. Next up, Meredith Beaupre. Ms. Beaupre, you have 2 minutes.
Thank you, everybody, for having this meeting tonight and reevaluating the mandate. I am in full support of extending the mandate to mask our kids while we are in this terrible part of the pandemic. It allowed my little one to go to school who was too young to be vaccinated, and I am grateful for the opportunity to have our youngest child in school where she is doing better socially than she was last year when she was home, which we did to protect her and other children by making it a little bit easier on the administrators to have just one less person to contend with in the hallways and in the classrooms and such. The masks, all of us who believe in masks know that masks are not perfect. We know that they do not prevent every single possible thing except for the fully fitted N95. Nobody expects that children are going to be wearing fully fitted N95, but we know that masks help. They help significantly. It reduces the likelihood that our children are going to get sick. We know that the vast majority of the people in hospitals with COVID right now are unvaccinated, and we have a huge population who cannot get vaccinated due to their age. So thank you for taking the heat that you're taking. Thank you for standing up and putting our children first. Please, please continue this mask mandate so that the children who can and want and need to be in school can, and those who do not feel like they want their child to wear a mask, that is fine. They have the choice to keep their children home. Thank you so much.
Thank you, Ms. Beaupre. I'm going to come out of order for just a second. We lost a caller before, and she called back, Dorothy Gregg. Ms. Gregg, you have 2 minutes.
Yeah, can you hear me?
We sure can.
Hello, can you hear me?
Yes, we can, Ms. Gregg. Go ahead.
Oh, okay, sorry. Listen, I have listened quietly, and I've been attending these meetings every chance I get. And I totally agree with the man extending the mask mandate. I totally agree. My grandson would not be in school right now if the mask were not mandated. And what I'm seeing, my other issue is, I'm hearing a lot from these angry parents who their children are feeding off their energy, their negative energy. You know why? If you're not following the policy, your child is not following the policy, then they need to suffer the consequences. So if you're teaching the child that they don't have to follow policy, Dr. Simon, Dr. McNeely, Rob, Gunner, and Tina, all of you guys, I applaud you because you have taken so much heat. I've been sheltering myself in place because there are people out there, like the one who's been on tonight, who really don't care about their kids. So I know they don't care about mine or you. So keep doing what you're doing. Don't let these kids, the kids are fine. It's the parents that are teaching these kids to be defiant. Just keep doing what you're doing, and I really, really applaud you guys. Thank you so much.
Thank you, Ms. Gregg. Our last caller for this round is Ms. Janine Playback. Ms. Playback, you have 2 minutes.
For Dr. Simon, Dr. McNeely, and Tina, Rob, and Gunner. You all know me. I've been an educator for over 20 years in Alachua County, and I was a nurse. I am a nurse, and I taught at DHS last year, first in order for the entire COVID experience. I have to say that I never thought I would experience another pandemic in my lifetime as a nurse and working through that, but we did it, and we thought COVID was bad then. I can't even explain now, because now it far supersedes the parameters that we used when we socially distanced, we masked, we did distance learning. I totally believe that all of you on that board love children, and you know I'm not in the county anymore teaching for the public school system, but I'm in a Catholic school, a Catholic high school, and I want to hear, and I want the public to hear what the diocese did the day before school started. The bishop and the superintendent of schools said unequivocally, the COVID rate has increased, you will now go to masks. We were not supposed to start school with masks, and we did, the day before school started. I am now observing, just like all these parents are, what's going on. And the kids don't have a problem with it. And of course, it is a private school, and the parents have a choice. the parents have a choice to come there. This is what the bishop has said about parameters, and I think the board might think about this, because we don't want to revisit this over and over again. So what the superintendent of schools and the diocese has done, has said to all of us, because remember, the diocese encompasses probably 8 counties, and they have said when the COVID rate goes below 10%,
Ms. Blayback, I gotta let you get out, I'm so sorry. All righty, folks, that is the last of our callers in this round.
I've already called the next citizens. Please come forward.
Hello, Chair McNeely, Council Ward, Superintendent Simon. What I guess there's been so much said tonight. What I want to say is that when we talk about rights and about your need to uphold rights, I think about the fact that your most important right that you need to uphold is the right for a child to have an education. And right now, if you don't keep the mask mandate, many children will not get that opportunity because they will have to quarantine or be ill and be out and lose very valuable instructional hours. In Hillsborough County, one of the counties that doesn't have a mask mandate, they have over 8,000 children in quarantine right now. Imagine the instructional hours that are being lost because of that. On top of that, I will just say, to quote a very famous and wonderful man, Martin Luther King, we have a moral obligation to break unjust laws. I don't believe you're breaking the law. However, if there is ever a law to be broken, it is one that is to protect our children, the most vulnerable, who cannot get vaccinated. So I implore you to please keep the mask mandate in place.
Commissioner, I'm sorry, I messed up your name totally.
Ma'am, you know what? I don't think I got handwriting in school. So it's all right.
We'll talk about that.
Good evening. I'm a longtime resident. Went to Stephen Foster, Raleigh, Fort Park Middle School, and U-Bolt. My mom was a longtime parent in this county. My sister was in school in the 70s. There were riots at their high school, at U-Bolt, with Ann Henderson. At no point did my mom ever feel like she had to come to a school board meeting. Moving back to Alachua County, I was proud. I talked about Alachua County is the most amazing county for an education. Teachers are fabulous. It's a great community. One of my classmates is in here. She's on the other side of this. I reached out to her because it was getting ugly. She ignored me. With this whole thing, people would rather dig in to their side than to put their egos aside and then listen to one another. I'm not going to talk to you about masks. Those public strings have already been pulled. You already know how you're going to vote. My concern is with the quarantine with the kids that are sitting outside of school. You talk about education is important. Education. We need to teach our kids. What have you done to educate these kids if they're at home quarantining? I understand they can get lessons on Canvas. Some kids may be able to go on Canvas and do the assignment. Not all kids are going to do that without instruction. What backup plan have you done? You have the ESSER funds, you have the CARE funds. What have you done to focus on education? You're going to do what you're going to do on masks. That's political, follow the money trail. We all know that. But what have you done besides posture for the media, the Democrat Party, in making this about politics? I'm a registered Democrat. I'm disgusted by the behavior I have seen by people up here. I have voted for most of you. I have reached out to one of you on an issue before, and you showed me you cared. Somehow in all of this, you've gotten lost. Find your way back to the students and the kids of Alachua County.
My name is Carrie Gillespie. I'm not going to go over the facts with you. You have them. You've already made your decision. We know that. But what I am going to say is that masking our children with virtually no risk is child abuse. Teaching our children that the air is toxic and the people around them are sick is child abuse. Stop using our children as a pawn for your political, to feel safer politically, and you're not doing it for the children, you're doing it for yourself. And doing it out of spite is child abuse. The school board, I don't feel, has our children's best interest at heart. for the simple reasons of employing or continued employment of teachers such as Joseph Waddell Jr., who blatantly put on social media how he was going to bully and segregate children.
I'm sorry, but we're not gonna be able to call names.
Okay, well, and another gentleman who works at the High Springs Community School has a record of rubbing and touching children since 2005, and as recently as 2017 and 18. So if you have our children's best interest at heart, how are these teachers still allowed to teach? Parents' rights matter, and if you had or have children, I'm sure you would feel the same way. Where's the inclusion, acceptance, and equality that you're speaking of? You're creating an environment of bullying by showing such continued support of these teachers as well as the masks. As in the beginning of the year before school even started, several parents withdrew their children from the Alachua County School Board. If a whole bunch of other parents continue to do that, you will lose funding and possibly your jobs as well. So that's something that you need to consider. Thank you. Go ahead, Trey.
Hi, my name is Shay Jennings. My child, my choice. I think the message on my shirt is very clear and simple. My children's health is my responsibility, not yours. Why would it ever be any different? I brought my children into this world, and I've cared for them for the last 17 and 12 years of their lives. I have been there for every sniffle, cold, flu, stomach virus, ear infection, and to comfort them through every sleepless night that resulted. Were you there when my son woke up screaming in the middle of the night that his ears hurt? No, you weren't. So why do you think it's your responsibility to make decisions regarding his health? It's not. Why do you think that you know what's best for my children? You don't. You are not their parent. You are not their doctor. You don't know my children's medical history. You don't even know their names. So why do you sit on your pedestal dictating what I should do to protect my children? It's not your right, it's not your job, it's not your choice. You don't get to make medical choices for my children, I do. I am their parent, provider, and protector, and I am perfectly capable of assessing. I'm almost done.
No, I want you to pull your mask up.
Oh, thank you. Well, can you add time back? Thank you. I am their parent and provider and protector, and I am perfectly capable of assessing their health with the help of their pediatrician if necessary, and making informed decisions on which precautions to take to mitigate the risk for their health. Masks are not the solution. Masks are not protecting these children. Virus particles are 200 to 2,000 times smaller than the opening in cloth and surgical masks. Masks are doing nothing to stop the spread of this virus. Every time you touch your mask, you contaminate it. Do you honestly think these kids are not touching their mask 100 times a day? Just as we sat here, I've seen grown adults on this board touch their mask 100 times. Is that a time?
Yeah.
I don't know, think about how you have dirty, sponges on your face.
Thank you. Good evening, board members, Superintendent Simon. My name is Carolyn Weber, and I am the mother of two children who are both in the Alachua County Public School System. First of all, I want to thank you for your service. I know that the past few weeks have been extremely stressful and emotionally draining for everyone. You have a huge weight on your shoulders as you are tasked to not only provide the best possible learning experience for our children, but also with keeping the children's teachers and staff safe. During the last meeting, one commenter posed a question. I believe he's here again. He asked if safety was more important than freedom. It seemed like a ridiculous question at the time, and I probably laughed. But the more I thought about it, the more I realized that there may be times when freedom is more important than safety. Generally, though, I feel that safety trumps freedom in many instances. This is especially true when it comes to children. Most parents do not allow their children to do unsafe things, even though it does impact that child's freedom. For instance, I don't allow my child to walk downtown alone, even though my 13-year-old would love to do that. And he would love to have that kind of freedom. So when would freedom take precedence over safety? I often think about the picture of the angry woman shouting at Ruby Bridges on her first day of school at New Orleans. I think about how scared her parents must have been and how brave she was to face down those people so that she and other black children could have the freedom to go to public schools that had more resources and opportunities. I think about the countless civil rights marches that often ended in black marchers being beaten or attacked by dogs so that they could gain the freedoms that white Americans have. I think of Harriet Tubman, Mother Jones, and countless other organizers who have risked their lives to ensure that others would have freedom. Thank you.
I'm still looking, and if Rochelle has already spoken, I'll discard this one. I'm going to ask for Ed Alfonso to come forward, please. I know you have to be up early for your route as well. And he may have already left. So the next citizens, Dr. Janet Silverston, Brian Brady Hall, Jeremy Archer. I cannot make out the first name, but the last looks like Weber. Maury Stern, Dr. Maury Stern. And then Ed Thompson. Once we finish with those citizens, we'll go back to our phone line.
I will be brief. I just want to talk about guidelines from the American Academy of Pediatrics, which is the organization that pediatricians use most to follow, because their guidelines are based on extensive research into everything related to whatever it is they're providing guidelines about, which I know because I've worked on guidelines and it's taken 2 years to get them through. Their recommendation is to have all students and school personnel who are not vaccinated wear masks at all times in order to prevent transmission to the other kids, because the kids are vulnerable. And the kids under the age of 12 can't be vaccinated. And that's the only protection they have. So I think that the only way that we can really deal with this in the schools is to have a mask mandate. So I fully think that you should continue with this.
Thank you, Dr. Jefferson.
Hi, I'm Brian Brady Hall. Thank you for the opportunity to speak tonight. Tonight, like 2 weeks ago, we heard clear and compelling testimony from local doctors and scientists, again, exhaustively, trying to convince you, and by extension the public, that we are amid a renewed public health crisis, and that, very simply, masks are a critical component in our collective fight against COVID. By this point, most of us understand that the rationale behind masks is not to protect the wearer directly, but to protect those around us by slowing and reducing airborne particles. The common refrain of, if you want to wear a mask, go ahead, espoused by people opposed to masks, is therefore nonsensical. Okay? The purpose is to care for each other In Genesis, God asked Cain about Abel's whereabouts. Cain, having killed his brother, replied, "Am I my brother's keeper?" The obvious implied answer was yes. Yes, you are. In the parable of the sheep and goats, Jesus explicitly framed this question, telling the sheep that whenever they had cared for others, they cared for him. And the opposite was true of the goats. Indeed, caring for strangers is a frequent theme in Judeo-Christian ethics and secular moral philosophy. It is reasonable that we should care for others because we too will eventually want care. Mask wearing in public spaces provides a basic level of care. Unfortunately, our governor cast doubt on the efficacy of masks in schools, citing a study by an economist, Emily Oster. The study from Brown University relied on data gathered before the more contagious Delta variant emerged, but more important, the study actually concluded with the words, and I quote, "We would emphasize that in general, in-person school can be operated safely with appropriate mitigation, which typically includes universal masking. It would be premature to draw any alternative conclusions about this question based on this preliminary data," end quote. The governor's order is counter to the conclusion of the very study that it cites as justification for the order. By contrast, the June 2021 issue of Science included peer-reviewed studies by epidemiologists concluding masks in schools significantly reduced COVID.
Thank you. The next, I'm so sorry, Beverly, for this unfold, but I want to tell our citizens that when the bell rings, I'm gonna make a statement for you to leave, and if not, then our deputies are going to respond differently. And Deputy, I'm sorry, I failed to say my statement. Next.
Thank you, Madam Chair, and, my name's Aaron Weber. Thank you, Madam Chair and Superintendent Dr. Carly Simon. I want you to know you are not alone in this, and we stand with you. Thank you for your courage and for protecting our in-person school year with a good public health policy. I'm a native Floridian. The Florida State Constitution requires a safe, effective school environment for our students. With the Delta variant, it is not safe for my children to be unmasked in school, especially for my unvaccinated youngest child. This is my children's third school year with COVID. They are tired of it. I'm all for the ideal of unlimited freedoms and parents' choice, but even I realize we are past that point and in the realm of a public health emergency coming for our children. I have not seen one parent tonight opposed to the district's policy of mandatory shoe wearing, which protects our children's feet. This is not the same virus as last year. The Delta variant produces 1,200 times more virus particles. This Delta variant can transmit in the time it takes for one person to pass another and then infect 8 others. In 3 rounds, 512 students are infected. You can easily see how one asymptomatic person can infect an entire school very quickly. Marion County just implemented a mask mandate yesterday for 90 days. This sentiment is changing in the districts in Florida because without masks, school boards are realizing COVID Delta won't let us have an in-person school year. I'm very worried about my youngest son. His elementary school in Kenobi does not have a robust public health policy as SFAC. On the first day of school last Tuesday, students in both 3rd and 4th grade attended school infected with COVID. This resulted in all 3rd and 4th grade classes being quarantined until Wednesday, right off the bat, during the first week of school. This is lost classroom time, which is very important and very distressing for my son. I'm also very much concerned for the SFAC educational support staff who come to our school to provide support and then travel back to other SFAC schools in the district. During outbreaks, I don't want our charter schools to be a shared support staff infecting other SFAC schools who are being very diligent with good public health policy. Please be aware of this side issue and help prevent the spread of COVID from our charter schools to our SFAC schools. Finally, and most importantly, please
Good evening, my name is Jeremy Archer. I grew up a student in Alachua County Public Schools and now a father of 3 children in Alachua County Public Schools. I'm also a pediatric cardiologist, a medical doctor who takes care of children with heart disease. And I've seen the worst of the worst from COVID, how it affects both children and adults. I know we all love our children. I know we all want what's best for our children. But I tell you, this is not a matter of opinion, okay? The virus doesn't care what you think. This is a matter of fact. So the facts in this situation, masks help. They don't work perfectly, but they sure do help, okay? Vaccinations work. They work amazingly well, okay? They're not perfect, but we gotta use the tools we have, okay? I wanna keep my kids in school. I want to keep our kids in school. I was really worried about keeping my kids home all year last year. I was glad to have the option of sending them to school. I'm glad to have that option this year. But we need masks in school to keep that option open to us. We need that option. We need to look at the facts and understand that we all love our children. And I do have this to say. A couple of folks implied there was kind of some financial benefit for physicians or medical professionals espousing masks or vaccines. What are my opinions bought and paid for with? I say this only with sadness. My opinions are bought and paid for with the blood and tears of children, okay? With so many tubes in and out of them just to keep them alive, okay? Tears of children wondering why their parents were taken by COVID. Wondering a year after COVID, are they ever going to feel normal again, okay? So thank you for your courage. Please continue to do the right thing. Good night.
Good evening, I'm Lori Stern. I'm a local pediatrician. I serve children and families in Alachua and surrounding counties, and my husband is an emergency medicine physician in Gainesville. And I speak for both of us. We have 3 children in Alachua County Public Schools at 3 different schools. We, over the past several weeks, have seen COVID-19 cases skyrocket in our community, both in pediatric and in adult patients. Our local emergency departments, hospitals, and outpatient clinics are being overwhelmed with COVID-19 patients and potential exposures and needs for testing. Everybody loves their kids. Everybody wants to protect them. And I'm grateful that we have a method to do this. At the last school board meeting, you listened about the dangers of unmasked children in school and the likelihood of increasing rates of COVID infections. These infections keep kids out of school. They lead to academic loss. They increase community transmission, and most importantly, put our vulnerable, unvaccinated kids and their families at risk for severe illness and death. Masks are a simple tool that are effective in decreasing spread and transmission of COVID, but they work best when used collectively. I see children of all ages wear these masks. I have seen children of all developmental levels wear these masks. They can do it, and masks do not cause harm. Quite the contrary, they protect our kids and they protect their ability to be in school without interruption. Over the past few weeks, I've seen kids across the spectrum of symptoms with COVID, from minimal symptoms to suffering. At the community level, these increasing rates are putting incredible strain on all of our medical services. They stress our medical system, and it spreads across the system: ED services, outpatient services, inpatient services, procedures. As we see more children and their families exposed, it affects our entire community and limits services to all. Thank you.
Good evening. Thank you for your patience, and to Superintendent Simon, Chairman McNeely, and board members. I'm Ed Thompson, a 35-year teacher of Alachua County and retired. I would like to come tonight to present 3 points that may hopefully will affect your vote in favor of extending the mask mandate. First of all, I'd like to say my first point is simply this: the Hillsborough County Public Schools said in a statement that 5,599 students and 316 staff members are in isolation or quarantine as of Monday. One of those students in quarantine is my niece's child who's in the 5th grade. Fortunately, of course, he was sitting beside a child that was tested positive for COVID. On Wednesday, tomorrow at 1 p.m., the Hillsborough County Public School Board is having an emergency meeting at 1 o'clock to discuss measures, and I quote, up to and including mandatory face coverings for all students and staff. This is a school system that was following the state guidelines, and now they are making some changes. Speaking Friday to MSNBC, Superintendent Davis of the Hillsborough County Schools would mandate masks while allowing parents to opt out. So the Hillsborough County schools are beginning to move to a mask mandate, and I hope you will continue to do so as well. My second point is simply this. In a week or two, we're going to have 60,000 more people or more here in Alachua County. They will be from all over Florida and many parts of the United States. They will be bringing with them, some of them, the virus. Some of those same students are going to need hospital care. And we will have hospitals that are being challenged.
Thank you so
Thank you.
much. All right, I don't see any other citizens. I think Mr. Thompson might have been the last one in this group. Collins, before we take any more, I want to give these last names out. Kate Desar, Melissa Brennan. It looks like Donna Kalasa, Evelyn Quirk, and Tanja Apia. Dr. Kartik Devabuddy. Josh Nick Lahara. Please be ready after our citizens on the phone line.
Yes, ma'am, I believe we do have, 4 more callers on the line. Go ahead with that, thank you, ma'am.
Yes, sir, and thank you, Madam Chair. The first of the 4 is Dentral Stark, followed by Commissioner Harvey Ward, followed by Carol Gordon, and Mary Udala. First up, Dentral Stark. You have 2 minutes.
My name is Dentral Stark. I'm on 2 kids in the public school system. I support the mask mandate because I have an elderly grandmother. Also, the parents that don't want their kids to wear masks, I suggest you guys take them to Shannon on the COVID floor. Sit them in their hours and see what your outcome is. Thank you.
Thank you, Ms. Stark. Next up, Commissioner Harvey Ward. Commissioner Ward, you have 2 minutes.
Thank you so much, Honorable Chair McNeely, Honorable Board members, Honorable Superintendent Simon. I understand what you're going through this evening, as not a whole lot of other people in our community do, and I appreciate what you're doing this evening. I want to tell you, first of all, that my 5th grader at Glen Springs Elementary wanted you to know that she loves school even with masks, so I'm so important to let you know that. I called tonight, though, in 3 capacities. First of all, as a fellow local policymaker, I want you to know that I am in complete solidarity with you, and I support the extension of this mask mandate. I want you to know that I'm also calling as a lifetime resident of our community, and in that capacity, I am so proud that I voted for each serving board member, and I appreciate what you're doing. Lastly, I'm calling the capacity, the board capacity, as parent of 3 children in your system. And I want you to know that I am deeply grateful that you are taking these courageous measures to make sure that while my children are in your care, they are kept as healthy and as safe as possible. And once again, I want to thank you for everything you're doing, and I hope that you support this measure this evening. Have a great evening.
Thank you, Commissioner Ward. Next up, Ms. Carol Gordon. Ms. Gordon, you have 2 minutes.
I'm going to be here this week. I just wanted to repeat a quote from Kentucky Governor Andy Beshear, who said, "Your individual liberty ends when it harms other people. And individual liberty does not exist to actively spread a deadly virus that can harm and kill other people. And I think you sort of stated it very simply from a big picture perspective. I know every parent is concerned about their child, and the freedom and the rights of the parents. But this, in the big picture, we're dealing with a deadly virus, and I'm just asking everyone who's so mindful of their children to try and be just as mindful of their neighbors and school staff and everyone around you. Thank you.
Thank you, Ms. Gordon. The last speaker in this grouping is Mary Udala. Ms. Udala, you have 2 minutes.
Yes, Madam Chairman McNeil, Superintendent Simon, and members of the board. I'm calling as a parent of 3 Alachua County public school students who are too young to be vaccinated. First off, thank you for mandating masks for the first 2 weeks to get us started. It's really the only way that we feel safe with our children in school right now. We do understand that universal masking is the safest choice to protect all children, and that's what the school board needs to look out for. Please continue the mask mandate to protect all students. Thank you.
Thank you, Ms. Udala. Madam Chair, that's the last of our callers in this grouping.
All right, thank you.
Hi, good evening. Thank you for this opportunity to comment. I'm speaking as an infectious diseases clinical specialist. I'm Kate Desir, Dr. Kate Desir. I'm speaking as a clinical infectious disease specialist at the University of Florida Health. I'm a fellow of the Infectious Diseases Society of America. My role at UF Health is to promote evidence-based medicine to improve patient outcomes. And while you can find a study for evidence-based or scientifically sound, though there are many voices to be heard, when it comes to infectious diseases, we are guided by peer-reviewed, scientifically sound evidence. And in this case, the evidence supports the use of masks to mitigate the spread of COVID-19. Others here have described the harrowing scenes at our hospital, and so I won't belabor that point. But day in and day out, I review our cases of COVID, and it truly is a preventable disease that is hard to watch. So your healthcare workers are not only experiencing physical fatigue, but compassion fatigue. So what I'm here to advocate is a layered strategy, including mandatory masks, but use this 8 weeks to buy us some time to develop a strategy with your infectious diseases experts and your other medical experts on your committee to develop a plan moving forward so we don't have to go through some of this nonsense with all of these viewpoints again. And we can develop a strategy whereby there's thresholds where we enact the mandatory masking and relieve it so that all are satisfied. So these same people that are advocating for freedom and right to choose are out there in the lobby mocking parents who tell of their kids with serious life-threatening illnesses. And so I think in medical evidence-based, well, my time is up, I think, when I'm yellow. One of the things that's hard for everybody else to grasp is medical altruism. And that's one of the things that we have to keep in mind as clinicians in infectious diseases is sometimes we're called to be altruistic and think of others and not just our own personal rights. Thank you for your time.
Thank you. My name is Melissa Wren, and a little bit more about masks and whether or not they are harmful for children. 2 months ago, JAMA, J-A-M-A, the Journal of the American Medical Association, the most highly reputed pediatric medical journal in the world, published a study that assessed the carbon dioxide content in the inhaled air of children wearing masks. The study showed that after wearing a mask for only 30 minutes, children's inhaled air held up to 2 to 6 times the level of carbon dioxide considered dangerous by OSHA standards. The study warned of hypercapnia. This is a sickness from carbon dioxide saturation, which leads to impairments of many organs, including the brain.
This is the Journal of the American Medical Association. So this is a peer-reviewed study, and if we're not going to consider it, that means that you are basically denying the most reputed pediatric journal in the world. So let's switch gears here for a second. Please raise your hand, school board members, if you think that the Delta variant will be the last variant. I didn't think so. Good, you're correct. In fact, as of 1 month ago, there were 9 variants listed on the CDC website. There's the Alpha, the Beta, the Delta, Eta, Gamma, Iota, Kappa, and several others that the World Health Organization has not even named yet. So COVID will be with us, morphing and changing for years to come. And no matter how well-intended we think we are, we will not eradicate COVID and its plethora of variants. And that is because this illness and its variants are hosted in many animals. So unlike smallpox,
Hi, my name is Gunnar McCalsa, and I'm urging you to, not not to extend the mask mandate. But I want to say before I share the main point I want to share, is that the folks who I've heard tonight who are in favor of the mask mandate, the main thing I'm getting from you is, that you care about the community, you care about everybody, you want everybody to be okay and not die. And I totally get that. I wouldn't want to be in your shoes trying to make this decision. I was on a school board for a few years myself, or a couple of years, and I imagine it's a weighty decision. But when I think about this issue, I see it not as being limited to just masks. It's really about masks and vaccines, or the vaccine, and lockdowns, and the whole thing rolls together as one big issue. And what I've verified for myself is that the lockdowns and the vaccines and the masks will end up killing more people than they will save. And the thing that I really want to say in my last, or the one thing I want to get across for sure is that because of Project Warp Speed, the vaccines were rushed through in a much quicker way than they would normally be, allowed to do. That meant that we have an emergency use authorization, which the good side is it gives us more chances to have choice if that's what we want. The downside is that in order to keep that emergency use in place, you have to have no other options. So all these other antiviral drugs that have been shown in studies and anecdotally to work, like ivermectin and hydroxychloroquine, is being suppressed. And the amount of repression, if I had another 5 minutes, I would lay out a whole bunch of cases for you where people are being censored. But I will say this, in the last few days, the Department of Homeland Security decided that if you are not for vaccines or COVID measures, you are now a terrorist threat.
Thank you so much.
Thank you.
Just a minute. Would you say your name out loud?
Tyree Field.
Repeat it slowly.
Tyree.
Thank you. Thank you.
Hello, my fellow school board. My name is Tyree Apia. I'm a candidate for Florida House District 21, who represents Alachua, Dixie, and Gilchrist counties. But most importantly, as it relates to mandatory masking in our schools, I'm a father of 2 children in Alachua County Public Schools, a nurse and a former military medic. Now I travel around the state of Florida and work with the state's most vulnerable people, and COVID patients especially. I can see anywhere from 25 to 40 patients a day. I hear that the board is data-driven, science-driven, so I have taken the time to really research the efficacy of our mask mandates. And last year we had some data to reflect on if these policies have worked. I quote from a study by Emily Oster, Dr. Emily Oster, and 4 other authors from Brown University titled COVID-19 Mitigation Practices and COVID-19 Rates in Schools, report on data from Florida, New York, and Massachusetts. It states that mask mandates vary across Florida. Some districts require masks for students and staff, some for staff only, and some for neither. We do not see a correlation between mask mandates and COVID-19 rates among students in either adjusted or unadjusted analysis. Even with studies like this, for some reason it seems like we're ignoring this, which is good news, and not the mass hysteria that seems to be constantly perpetuated. Lastly, I want to say I'm greatly disappointed in this board, not just because of the mask mandates, but most importantly because my children look up to the school board, adults, teachers. You're supposed to be role models for these kids, and to break the law, the Parents' Bill of Rights, flagrantly for 5 minutes of fame on CNN, and to divide the county into what looks like the new age Jim Crow is completely and utterly disgraceful. The superintendent should be removed or should resign from her position, dividing this county from media interviews. She wants to be a star at the cost of violating the law and using political force to bully people in submission. You should be ashamed of yourself. And I apologize to these parents.
Thank you so much.
Do I start now? Okay.
Can you speak into the mic?
My name is Evelyn Cork, and I am a 7th grader at Lincoln Middle School. And I strongly support masks being mandated. Partially because you can't really social distance in schools, despite it being like encouraged. There's not enough space to do that, and 3 feet isn't really going to cut it when it's supposed to be 6 feet to keep it safe. So getting vaccinated is really important, but for people who choose not to do it or they just can't do it, masks are kind of like the only thing that you really have to like keep yourself and others safe, besides like sanitizing and just like being sanitizing yourself after touching things. So I really think that we should be doing everything possible in order to keep students safe, and that during a pandemic is not the time for half measures. And let's see. I also think that it's really important to put public safety before your personal comfort. So I understand that some people don't like masks, or maybe like they hate them, but it's really not about you as an individual. It's about everybody. And I also have noticed a lot of the time that it seems as though parents are speaking through their children and using them to voice their opinions. And I think I've talked about this before. I think that you also have to remember that even children who think that they're speaking of their own accord, you have to remember that younger children look up to parents as though they're always right, and that their opinion, the parent's opinion, affects what the child thinks about a lot of things. You have like you're kind of responsible for their opinion in a way.
Ms. Cork, thank you so very much.
My name's Josh. Here today to talk to you guys because this mask thing is not about whether it works or not. It's about how much it works, okay? And what we're paying for it to work. What we're giving up in for that little bit of efficacy, that 95% that deteriorates over time, okay? Because there's gonna be a cost for wearing these masks all day. Run year 2, almost year 3, you can look at it differently. And it's not going away, like somebody else already pointed out many times. So, by you mandating this, it's on you. What happens? It's on you. Thank you. Pay attention.
Your time is over. But you must leave. Not welcome here
That mask is the reason why I can't kiss my wife goodbye in the morning.
because the medical issues that she has to wear them every day.
Thank you, deputies. The next group, and, we're going to add, oh, I'm sorry, I didn't look that way, thank you all. Yes, sir.
Dear board, thank you. Name is Dr. Karthik Chervudi, an infectious disease specialist at UF Shands.
Just a minute.
I'll co-lead the infection.
We're gonna start your time again. Quiet in the audience.
Dear board members, thank you. Dr. Karthik Chervudi, an infectious disease specialist, epidemiologist, scientist at UF Health. I help co-lead the infection control measures for UF Health. We also perform research at UF, which has contributed to a lot of learning about how this virus spreads. Our study first showed that the COVID virus is airborne, unequivocally. Patient unmasked, it was shown that COVID can spread 16 feet in the air. We did the same study looking for the virus, active live virus, in our hallways where all of our nurses and healthcare personnel sit. All of them masked, with simple masks. No virus was isolated in any of those hallways. These masks, whether paper or surgical or cloth masks, work when all of us wear it because they offer source control. That's how they work. I wouldn't come here without wearing my N95 if I didn't know for sure all of you would be wearing your masks. That's the only way we're safe right here right now. If that wasn't the case, I would have come with my N95 here. Children can't wear N95, certainly not for that long a period. So for it to work, every single child, every single person in an indoor place needs to wear a mask. That's the only way it works. We know that for sure. We have done these experiments right here in UF. The CDC and others have used our evidence to make these guidelines. So you trust us to take care of you, trust us when we're telling you these work. Thank you.
And I'd like to add Mr. Marlon Bruce to this group. Please go forward.
Thank you, Madam Chair. My name is Nicholas Lahara. I run for school board, like all of you. And what I can say is that this is a clear disgrace to the oath that you have taken. You sit up here, pretentious, power-crazed individuals. This isn't about safety. It was never about safety. This is about poking the governor in the eye because you guys are upset that he has taken action against you. And to quote Thomas Paine, a great political philosopher, the Lord would not send an ass to do a lion's work. And this is how we sit up here looking at this. We have community members from all abroad telling you they just want a choice for their children, and you are denying them that choice. I urge you to end the mask mandate, allow those who are comfortable wearing masks to continue, but at the end of it all, it is a choice. Benjamin Franklin said, those of us who are willing to give up a little bit of freedom for safety deserve neither liberty or safety. And remember that as you vote. Thank you.
Hello everyone, my name is Marlon Bruce. I have the great benefit of holding numerous titles in this great county. Educator, Chair of Economic Development for the County Board, and a host of other titles. I'm here today to implore you to see reason and to end this mask mandate. But I'm not here to debate whether masks are good or not. I'm here to to actually describe what I see in this failure to follow the governor's order. It's a reoccurring disregard for the rule of law. You guys have had a school board member who did not belong on this board sit on this board for how long? You colluded in public to keep that school board member on your board, and then you tried to rush through numerous votes while the school board member was still illegally holding her seat. Above all of this, you now go forward, even after the governor has told you, even though each one of you are under investigation by the state school board, you continue down this dangerous path. It's a reckless path. And honest to goodness, I really do hope that the full weight of the law is brought before this board, because it's about time that someone places a check on your reckless endangerment of children's lives. You've heard it here tonight by numerous people. These masks are going to cause children to get sick. Your quarantine children are quarantined because they were next to someone with COVID. How many of them are actually sick is my question. I'm sitting here today, and I tell you, from what I see, I couldn't tell this school board apart from the Taliban. It's that bad. So I really do hope that we are going to correct our course. I really do hope that you guys get right real soon. And I really hope that from all your CNN polls that your campaign coffers are fully filled. Thank you so much and have a nice day.
Amen.
Is Dr. Hartek, I think he might have been the, thank you, you're good. I didn't want to miss anyone. Has Lahara Nick spoken? Okay, then we're now to our last phone calls, because this is my last group.
And Madam Chair, would you like us to stop adding new people to the queue for the phone call?
Probably so, at this point. We've had enough stuff tonight already.
Adam, how many callers do we have left?
I have 2, sir.
That's great, 2.
Would you like to take them now?
Yes, please.
And
All
all
right.
those 2.
First, we have Leah Cohen, followed by
Just a
Sean
minute,
Derrick.
just a minute.
Leah? Huh?
I couldn't hear. We have some chatting in the audience. Okay?
Are we okay?
Yes, sir.
Adam, go ahead.
All right, first caller, Leah Cohen. Ms. Cohen, you have 2 minutes.
Thank you. My name is Leah Cohen, and I am a parent of 3 public school children in Alachua County, 2 of which who can be vaccinated and are, and 1 of which who cannot. I'd like to quote the Florida State Constitution. The education of children is a fundamental value of the people of the state of Florida. It is therefore paramount, in our paramount duty of the state to make adequate provision for education for all children residing within borders. Adequate provision shall be made by law for a uniform, efficient, safe, and secure and high-quality system of free public schools that allows students to obtain a high-quality education. And Section 4B says the school board shall operate, control, and supervise all free public schools within the school district. Ultimately, you have countless medical professionals, I'm no longer quoting the Constitution at this point. Ultimately, you have countless medical professionals who have it drive strongly for mask mandates, and that must lead you to a mask mandate. In the statement, quote, to provide safe and secure public education to all children who reside within its borders, it also must lead you to the mandate to address the mask mandate to address the disparities of access to medical care and resources, and that also must lead you to the conclusion of the mask mandate, those disparities, in order to protect all Alachua County students and not cater to just those who have the privilege or the confidence to not be inconvenienced to wear a mask despite the risk.
I gotta let you go. I'm so sorry.
Thank you.
All right, next up, Sean Derrick. Mr. Derrick, get 2 minutes.
Is it okay if we put our mask down below our nose?
My name is Sean Derrick. I am a father of 2 students in Alachua County.
Thank you.
And I believe you guys have pretty much made up your mind on how you're going to vote tonight. So my question is not necessarily about this mask mandate, but where will your overreach stop? You know, we are basically living in a world that will never be COVID-free again. The virus has proven that it's going to continue to evolve year after year, just like the flu, and we will never be COVID-free in our society. So at what point do we prioritize our children's safety over your need to control the populace in our county? You guys have got to come to a conclusion that we are not going to get rid of COVID. And the 7-day rolling death averages that have been inflated by our county by the superior healthcare system that draws people from all over the state has made numbers look far worse in our county than they are. And until you guys put a foot down and say that our children are more important than your primetime slot on CNN, you do not belong in your office any longer. I'm asking you to come to reason with the fact that this is not going away. And our children should not have to grow up in a society where they have to veil their face like women in Afghanistan. It is not okay to continue to make kids choose between a false reality of safety and your mandate. We should not have to pull our kids out of school to stop you guys from being tyrants.
Thank you, Mr. Jarrett. That's it for all of our commenters, Madam Chair.
Thank you so much to all of our citizens and especially our physician professionals. Thank you so very much. At this time, we've already set a motion, and it is now time for our discussion.
Madam Chair.
Mr. Hyatt.
Thank you, Madam Chair. And thank you to our citizens who spoke today. I wanted to say after the last meeting, I got a message from one of my students from 42 years ago. And she said, well, was that you? I just saw quoted in wherever. Now, I didn't know I was quoted because I didn't interview. I didn't do an interview, but somebody took it off of, I guess, what I said in the meeting. And I do appreciate this reporter because I thought it capsulized what I said and quoted. So I'll quote myself. I don't think that we need to get in any kind of match with the governor. To me, it's not being defiant. It's being reactive to what the situation is. I don't feel good about having a conflict with other elected officials. That's not the way I look at it. And I could be totally off base here. But the way I look at it is, we received in this meeting 2 weeks ago, compelling expert testimony, if you want to call it that, about the conditions that we face, not what Broward County faces, not what Hillsborough faces, but what we face in Alachua County. I'm not, I'm not concerned about Washington D.C. and I'm not concerned about any developments there. I think we should be laser focused on what's happening here, what we can do to mitigate the spread of the virus right here. So that's where I'm coming from. I'm not looking for a fight. This is by definition political, but that's not where I think it's important. So I do thank the medical experts, and I know that I spent quite a bit of time outside the meeting talking with experts and MDs. So I feel comfortable that this is the best way forward at this time. So I hope we can take the advice and go for another 8 weeks and see if the predictions are correct and there is a tailing off. That's what we're hoping for. But I have to depend on the expertise of the folks that are helping us. Thank you, Madam Chair.
Can our children quote you when they disregard
I'm sorry.
the mask mandate?
I'm sorry. Just a minute, please. Mr. Hyatt, thank you very much. Dr. Paulson?
Yeah, it's, just like I said at the beginning of the meeting, this is, we're just arguing among ourselves. What I said all this stuff is we should have got together, get a plan, see what we can do to present and work in unison, even with the governor. Now, we sit there and we say freedom. You know, there's different ways to look at it too. We're elected to run the school. So why did the governor make things so hard that we couldn't do it? Example. And a few people brought it up. We had something that worked pretty good last year. We had a teacher come up here about the high flex even for second graders. Remember that teacher? She's still here? Anyway, she came up and taught. That would help solve the problem. Yet, he purposely kept us from being able to do that? Now, he needs to be asked that question. That's infringing on freedom, on our freedom. So that's, that's another way to look at it. If we could solve this problem. But you gotta give a little. I've negotiated a long time. If any people you know who I am, I've negotiated contracts for 30 years. I've done arbitration. This is not working together. This is not working together. I'm not saying you get, when we come out, that you're gonna get what you want. But at least we can try. We had a young lady, a doctor, see her? And you said we should have a plan, right? Isn't that what I said 2 weeks ago? What's wrong with having a plan? And you get out here, and then now we're fighting among ourselves. Fighting among ourselves. If you come out, and look at this committee to work on it, we should look at things. I'd like to see us, when we vote tonight, we should vote if we have an opt-out. We should mention that, don't you think? I mean, that should be part of our motion. And I'd like us to look at other districts. It doesn't mean Leon County, do they still have a medical? Marion County, they do a good job. Do they have it? I don't know. We should look at that. Doesn't mean we have to do it because they do it, but at least we researched it. That's all I'm asking you to do, is us research. And then we can talk among ourselves. But we got to, we're in an emergency. Emergencies call for strong measures. I think I'm correct. This is an emergency. And I'm going to sit there and tell you, if you don't think we're in a surge in this pandemic, then I think people need to reassess the way they're thinking, because we are. Now, let's get together and work together. We can have a plan, just like you said, just like I said. Has anybody thought about plexiglass and put it in the classroom for the elementary kids? Would that be something that could help? Just throwing that out. I mean, I'm not an elementary school teacher. I was a high school teacher my whole career. But that might work. But these are the things, and if we go 8 more weeks, I think we've got to get working. What are we going to do if we do see the curve flat? Are we just going to stop and go in, or should we have a plan to make sure we don't go back into it? And I asked for a plan. I don't feel like we did. I think I got ignored. But that's between us. And we all can disagree, but when it comes together, I don't think there's anybody here that wants to see the school district grow, where these kids get hurt. Everybody's here, for the same reason, basically. We just gotta bring ourselves together. And, I spent a few years in this district. I started in 1970. That's a few years. I love this district. Just like I'm sure you guys do. But we got to stop this arguing and everything. You know, there's another thing, and I don't know if this is true, somebody told me charter and private schools are all have mask mandates. Now, I'm making a phrase and statement that I haven't researched. But we did hear the Catholic school. So where are you gonna go? And why can't we teach kids at home? Why, you know, this, I'm not out to fight DeSantis. But I do think when you say the freedom, this is a two-way street, you know. The argument can be made that our freedom is being stepped on too. And that's, you know, you want to be taken over by Big Brother? That's how I look at it. State's not there to run everybody. But we have individuals, we have school boards, we have county commission, because government works best closest to the people. So, you know, when I say this, I'm gonna vote to go to 8 weeks, but I want us to be looking, if that 8 weeks ends and we reevaluate this, I wanna see us have a plan going forward. Thank you, Mrs. DeSier. I loved it when you said it. I think I did correctly interpret it right, didn't I? And I just wanna make sure I'm not just taking literary ones. So anyway, that's why, you know, we took this trip. I spent a long time, I got a 54-year-old daughter that went to school with us, and a 48-year-old daughter, that's how old I am. And I love this place. I came up here, but God forbid, I said I played football, that's how I came up here on my education. And I stayed there since the exception 2 years I went to their house. So I hope we can work together, I hope we get together and have ideas. That's why I threw out a few, I saw one person with the plexiglass. Yeah, so I mean, you know, it's something you can have these kids if you don't want to have masks on, right? Look at the picture. I mean, but we didn't talk about these things, did we ever? Should have. Work to me, work. So anyway, again, ask the question. Why couldn't we do what worked last year? And you don't think it worked? You saw the scores. We didn't lose. We kept the scores up higher than most every other district in the state. Did we lose some? Yeah. But we still got some education for these kids. So why? You know, why couldn't we do that? Did any of you that are supporting them decide that wants to not have that? Did you ever ask that question? Did you ever ask that question? Huh? Why did he do what he did? Now, Corcoran also said he wants to have 2/3 less public schools before he's through. Now, you look that up. You think that's good? You know, I don't like people like that, because I'm a public school advocate. I didn't say it was the governor said it, but Corcoran said it. So anyway, that's why I'm gonna vote that way. That's why I'm passionate about this. I'm disgusted about us not getting along. That's the worst thing I came in here with a bad attitude. We gotta get along. My God. Okay? You know, out there, they're gonna do it. I think we can. And we get to work. But again, I'm gonna vote for the 8 weeks, but I want to see something done during that 8 weeks. Get together and get people, and let's look at people and come up with some ideas and get that plan you're talking about, Dr. this year, okay? That's what we need. All right? I'll shut up before they kick me out. Thank you.
Thank you, Dr. Paulson, as a surgeon.
Thank you, Dr. McNeely. I'd like to thank our citizens who took the time to email and call us, those who came out and attended the meetings tonight. And I'd like to especially thank our medical community for their continued advice and advocacy, for sitting through another long meeting. Thank you for your commitment to helping our community and for giving us unbiased, scientific, evidence-based information from which we can form an opinion to make policy to govern the students and the residents of the Alachua County School District. When I took an oath, and I took my office on November 18th, I think it was, November 20th, 2018, I swore an oath to uphold the Constitution and state laws, which would entail us creating and operating a school system that would be beneficial for the majority of the students, to provide a safe work and learning environment for our students, and I take that seriously. Like Dr. Paulson, I have a strong affinity, a strong love for public education because I'm a product of public education, and education has served me and my family well. But when it comes down to it, I feel that this decision it's unfortunate that what we're dealing with now has become political, but this is a public health issue. That's what this is. And so when we have health issues and things of that nature, we have policies on here that tell us how we're supposed to handle students that come with communicable diseases and things of that nature, what they can do, what they can't do. We can remove them from school. And that's an important thing. This is not something new. This is not a new action that we're having to take. It's just that this public health issue has become so controversial because it's just become political. And we're very fortunate that this virus has been researched for a long time, and that the scientists were able to come up with a vaccine to help us to mitigate and stop the spread of it. And it's just unfortunate that it's become to a point that there's a distrust of the medical science and the process. But I think as an elected body, I'm one, and just have one voice up here. I think we have to, as I said on August 3rd, we have to use all the tools that are at our disposal. And for our youngest learners that are not eligible to receive the vaccine right now, our greatest tool that we've told that we have in our bag is masking. We have more students back in the district now in the classroom. Unfortunately, as Dr. Paulson has just said, that the Digital Academy was not approved by the state of Florida. When parents called in and asked at the last emergency meeting that they would allow that option, the response from the chair was that we have one virtual school, and then we have, if your district offers, e-school. Those were the options that were given in that meeting. So we have brick and mortar, and our district does offer e-school, but we are, all of us up here, I think I can speak for all of us, we want to have in-person learning because we've heard and we know that that's what's best for children. It's unfortunate that we want society to be open, we want schools to be open, because schools kind of function as childcare. That's what a lot of people really need schools to be open. And I was told by one of the local charter school principals that a parent brought their child to school knowing that child was sick. 2 children came, another one came and had stayed with a relative that was COVID positive. And so they came and exposed other children to COVID. And the excuse that or the reason that one of the parents gave was that she had to go to work. She didn't have any other option. She needed child care for the child. So I just think some will say that was her right, but she also has a responsibility with being a parent to make decisions that don't impact other people negatively. And, you know, my family has given up a lot. I know people who, you know, they're struggling with trying to arrange childcare and things like that, and the children do want to be with their friends in school, but we've got to do things to mitigate the spread of this disease in our school system. And, you know, I have a family member that's dealing with cancer. She's undergoing chemotherapy, and her granddaughter was extremely ecstatic to go back to school as a 9th grader, and one of her friends came to school and was positive for COVID. So, and she'd been around her grandmother, but so school started Tuesday. They found out Thursday that this classmate, that she has 3 or 4 classes with, is positive for COVID. You know, so I think that, you know, we want to do what's right for everyone, but, and I hate that the students are missing out. I was just plumb sick for the class of 2020. They lost their graduation, their prom, grad bash, all of that stuff. And this past school year, I kept telling all the students when I go visit the campuses, please wear your mask. Please socially distance, or you all will not have a prom, you won't have an in-person graduation. But because we practiced those mitigation strategies that the doctors and the CDC and public health officials told us to do, we were able to get our numbers down, and we were able to have some form of graduation. People still weren't happy with it, but it was better than the drive-through. Even my family was impacted by that. My daughter is in pharmacy school, And getting her white coat is a really big thing. It was virtual. It was virtual, so that big event for our family, you know, that was something that she wasn't able to do. And then we had people that graduated, we couldn't attend the graduation because they only had 4 or 5 tickets to attend graduation. So this is a serious issue that we're dealing with here. I know several people that are dying of this disease. Two family members of my friends of family, my husband's family. On the same street, 2 people died just recently, last few days from COVID. So this is serious, and I respect the rights of parents, but at the same time, there is in one of our policies that we have to do what's best for the school system as a whole. And as a community, it was said earlier, we have to do things to sometimes an inconvenience to one, but they benefit the many. And this is hopefully, if everyone is complying within our school district and in our county, and if people would just, everyone that's eligible and their medical health will allow them to do that, please get vaccinated, have your children vaccinated. You know, football season is getting ready to start. I would hate for any of the teams to have to forfeit a game because they've got a breakout on their team or have to withdraw from a state tournament, much like our volleyball, one of the high school volleyball teams had to do last year. So please, if your children are eligible to get vaccinated, please do that. And if your children have any symptoms or showing anything, please keep them at home. Don't take them to school and risk the health and safety of the children. But we also have to have staff. We can't run a school district if there are no adults in the district. The 4 of us and Dr. Simon can't go staff to school. So I said all that to say, you know, and sometimes rules have to stand up for people of color. If there weren't people that pushed back against the system, and the rules and the laws that were in place, we'd be still sitting in the back of the bus. We'd be still be in school systems that had less resources, but we were paying taxes and we weren't getting an equal education. We still have been experiencing legalized redlining. There's a lot. So sometimes there are ways that you have to stand up and you have to push back against things when you don't think that they're the right way to go. But this is life or death right here. That's how I see this rule. And, you know, if it calls for losing my salary, that's something that I would take, losing my job, I would take that over saving the life of a child or another employee. We've had 2 employees this school year to die and 1 student already in North. So this is life and death. This isn't anything political for me. Thank you, Dr. McMorty, and my colleagues.
Thank you, Ms. Search and Dr. Paulson.
Yeah, I just, real quickly, the most important thing I left out is we have got to get our e-school up and going strong. We have got to do that. We talked about it, it's a priority, right? This can be a priority, the e-school.
E-school is ready.
We want it running strong, that more and more kids can be there. Okay, well, I want to look at it. You're right. But the e-school is a legitimate alternative. I'm not. Okay. A legitimate alternative, okay? I just wanted to say that. And we can also have ESSER funds available to do a lot of things we want to do, right?
We have ESSER funds available. We do have some limitations with providing
Oh.
digital academy, but I think
We can do-
continue to have those discussions.
Oh, but we can use, I wouldn't want to do it, you know, there's places we could use to do the things we're talking about doing tonight. So there is money, so that's the other thing, all right?
Dr. Simon. All right. I want to say again to our medical professionals as well as the experts in the audience, I can't tell you how my heart beats for all of you, because you have sat through all of this with us. You know the importance, and you know that you want to hear where we're going with this vote. But before I go there, I want to thank some of the people in the audience. Ms. Wise, just raise your hand. Ms. Dorella, Dr. Edwards, Mr. Andrew, Ms. DeShola, Deputy Superintendent Jones, Chief Hamilton, Mrs. Johnson, she's probably not in here. Well, okay, we can't see her hand, all right. I don't know if Mrs. Peck is still here. Oh, she's here, all right. Mr. Coles, I hope I did not miss anyone, but Superintendent, Simon, I want these folk not to be in the office at 8 a.m. They have been here all day long, and I'm asking permission that they can come in later. I didn't say not come in, but we would stagger some things. I hope you will take that in consideration. I got here at this county office at 4 o'clock this afternoon. I don't want any calls to come in before 11 in the morning. I'm telling my citizens and staff that. I mean it. Even more so, I'm just gonna answer my phone. But this position is so important. And it's important to me because we have been elected for the students in this district, no matter where you sit, whether you're on this aisle, sitting on this side. But I know that it is my right to do the best of the best. And as I said before we even came over here to the county commission auditorium, or chamber as they call it, I cannot take one child. We've already lost one, but I cannot fathom one other child, not one, getting very ill, getting the COVID-19, the Delta variant, and I can hear the doctor say tonight, but I've even heard of a Lambda variant that may be coming around. I don't think I was making that up, I heard it. Let me tell you, some citizens said tonight the variants aren't going anywhere. And I thought, could be right, but that means we'll mask more. We will vaccinate more. We will use up all the Dove and Ivory soap that we can when we're washing our hands. We will social distance, and every school that's being built from here on out will probably need to have more square footage so that we can do things differently in our schools, especially with the ones that we are now in the process of renovation. I'm here to tell you, when the doctor, and I listen to all of the medical experts, but when that doctor, and I can't remember his name, 2 weeks ago, I've been telling everybody this, when he said to us about the mask, and had we, I don't know about you all citizens, but if we had ever held a dying child in your arms, that has haunted me since the 3rd, because I have not. But I was just imagining if I had that opportunity, or was your child, or my grandchild, how would I feel? And then, as he stated, walking out into the area where the parents are and having to tell them that their child had transitioned. I cannot stand it. And when I sat there this afternoon at 4 p.m. with the emergency meeting between the State Board of Education and what my superintendent had to go through in answering those questions. Some of them were good questions, but the majority of them, I won't even call the word, because you probably know. It was unbelievable. And I will go home tonight, because this is my time, and I will dial in to the State Board of Education to hear what Broward stated. because I'm sure they had the same type of questions that the superintendent of Alachua County had to answer. This isn't about her right now, but I'm gonna say it, and you can get after me later. But she was on point. And no matter how they tried to twist her things that she needed to respond to, she stuck to what this is all about. I hope, and I hear Dr. Paulson saying we need to work together. I've always believed that. And I can be the most competitive person in the world. But when it comes to the children, the families, the staff, the community, I'm here to tell you, take this little bit of money, if that's what you want. And the next thing they came out with today, if you haven't heard it, they would like for all of us to be unseated, every last one of us, because we are standing for what is right. If you got to do that, then I'm hoping the next board that the governor puts in will have as much guts as we have and the most integrity that we have and that the superintendent has. I thank you for all of you that have commented, emails, and I thank all of you that said some things to us. It's okay, because that's your right. And I thank those of you who have emailed us and gave some encouragement. I appreciate you all. You're citizens of this community, and we are here to serve you. I think that when Dr. Paulson says we need to have a plan, I want you to know that the plan that we presented some weeks ago with the reopening plan and thus far down the journey, you may not think it's the most concise plan, but I want you to know that the staff who's sitting over there on that back row, they have been working toward every plan that we have currently. It's only 10:27, so I'm going to keep talking. And I saw Miss Certain Head go like this. I can see out of my perimeter. But I have, go right up on, you can tell us your vote, but I'm gonna keep talking because I feel like talking. Yes, his wife is very ill and he does need to go, but I'm gonna keep talking this night. I see Mr. Rella drop his head, but I'm gonna keep talking because it needs to be said. What we're doing will impact every child, whether your parent says no, you should not wear a mask and you need to do the exemption, or we need to take the Hope Scholarship. Whatever your choice is, just know, parents, that we are here for your kids. Wherever side you sit on, we are here to educate your children if you give us that opportunity. I heard Dr. Paulson say he loves this district. So do I. He said he came in 70, I came in 72. So you know now how old we both are. It's okay. I still have my senses, and I still want to work with all of the kids, but certainly keep them safe. That is the number one thing. Keeping them safe, keeping them safe. We wouldn't have gone through the Alice event, the Alice training, if we were not, and the new Alice training, if we were not about the safety of our kids. When it comes to your health, though, I don't know anyone in here who has not been to a physician, to a doctor. And no matter what they tell you, you try to go and do what they say. That's why you pay them. or that's why you hand them your insurance card if you don't pay them. But if you listen to your doctors when you go in for treatment, why in the world would you not listen to them now? That's what I can't understand. Well, it's a lot. I hear grumblings up here on this dais, but you know what? It's okay. They can huff and they can puff. Because each person had all the time you wanted to take. And if you didn't take it, too bad. I want you to know that it is imperative that you have your children to understand what's going on. It's very difficult when children want to listen to their parents and then come into the school room and they want to listen to the teacher. Think what you have done toward the kids, because you put them in the middle and they're only children. They don't want to go against the parent, and they certainly don't want to go against the instructor. But just think of that. The next time that you speak to your child about what you're going to do the next day in school, please, I implore you to do the right thing by these children. If you feel that the parental choice is not there, look back at our plan. You do have some choices, and you have two major ones. I may be missing, but you have the opt-out and you have the Hope Scholarship. Or you can decide, I'm going to teach at home instead. 3 choices. I hope you will pick my choice, and that's to allow your child to be a part of the Alachua County public school system. 10:32. Mr. I know you need to vote out. You tell me to be through? I heard somebody say yes on that. And so with that, I'm going to say a few more words, Ms. Serta. I want you to know that we care about every single person in this chamber, every one of them. You have put in a lot of thought and a lot of decisions that you need to do. Stand with us, please. At this point, since I'm getting to people on either side of me, and Dr. Paulson does need to leave, but we still have some other things after we take the vote, according to our agenda. All right, so we're going to do roll call. And we'll start with Ms. Serta. Aye. Mr. Hyatt. Aye. Dr. Paulson. Aye. And no doubt in your mind that I stand with that. It is unanimously a 4-0 vote. Masking, but I'd like to go back and clarify, because I heard 2 board members saying 8 weeks. I would like even longer, but are you saying 8 weeks, Ms. Serta?
That was the motion. That's the motion we just voted on. That's what the doctors asked for.
I know what the doctors asked for. I'm saying.
And that's what we put forward.
That was part of the motion. Thank you, Attorney Delaney. Thank you, Dr. Paulson. Thank you, Ms. Serta. Thank you, Mr. Hyatt. It is a unanimous vote that we will be in mass for 8 weeks and then reevaluate at that time.
And we'll work on a plan.
And we will incorporate many of the things we already have.
No, we'll work on a plan.
I can't agree with that. Because I know we have a plan. Thank you, doctors. And last time you held your hands up, I'm still asking that of you. You know what I mean about helping in the schools. Okay. Thank you all. Thank you so much. Yes, ma'am.
Can I have one, thank you, that was, I don't even know who it is. I just wanted to say thank you to the wonderful woman who's been cleaning up after us.
Oh, absolutely.
Each time, I don't know her name,
I got a lot of people up to see it. Thank you so much for saying that.
Thank you.
All right. I couldn't hear you. I know. We are now at citizen input. Excuse me. We are now at citizen input on our agenda. I think we had a lot of it tonight. Thank you, good night. But if there is anyone who has not had an opportunity to speak, seeing none,
Madam Chair,
I'm-
Madam Chair, do we do have some people on the phone?
is it the last piece
No,
is
this
over?
was for general public comment.
All right, thank
Is that
you.
what we're
Go
doing?
right ahead.
All right, Adam, how many people do we have on the phone for general public comment?
Good night.
Adam, you might be muted.
Josh, you calling on me? I can't hear you.
Yeah.
If that was affirmative, I will call on Jill Amy. She's the only caller that I have in the queue.
Yes, okay, so we have one caller in the queue for general public comment. Adam, sorry, my microphone died.
Yep, that's correct. We have one caller. I
Is it
think
not
she's
about
still-
masking?
Yes, it's general public comment.
Thank you.
Yes, Adam, we'll take that now.
Okay.
Great. Ms. Joe Beatty, if you're still here, you have 2 minutes. Jerry, still out there? Looks like we may have lost her, everyone. I have nobody else in the queue.
Thank you very much. At this point on the agenda, we are at board member superintendent request.
I don't have any requests, I guess, I don't have requests.
Mr. Honey? No request. Dr. Simons? Okay, all right. Okay, at this point, since there are no, board member or superintendent requests, this meeting is adjourned.